Hey everybody, thanks for joining us. We are on Lymphatic 7, and you don't have to have any of the previous lymphatic classes to be able to jump in and do any of these lymphatic classes, but it's just a series where we go through and we explore the lymphatic system in great depth, and not just the lymphatic system, but things that contribute to lymphatic function. And remember, lymphatic function is how hormones get carried throughout your body, and it's your body's ability to detoxify. Energetically and esoterically, it's also how your body is able to throw off lower vibrational energies. So you could say indirectly it ties to psychological healing. It helps to accelerate physical healing because you're throwing off the lower vibrational energies that would manifest as blockages or the energy of decay or degeneration. And it also is tied to throwing off like lower emotions and even affecting how we think. You think about like sometimes when the lymphatic system is backed up, one of the byproducts is fuzzy thinking. Your brain isn't able to process things cognitively because of the body being toxic, right? The other byproduct of the lymphatic system when it's congested is it overexcites the sensory nerves. So you become hypersensitive, and the nerves fire at anywhere from 5 to 10 times the normal rate. And it eventually causes brain fatigue. It makes your body experience pain to a higher degree and produces brain fatigue. So these are just the highlights of what happens with a backed up lymphatic system. But there's also little nuances that we explored in some of the other classes. But here we're exploring the neck. And so many times we think of the neck as just like, oh, I've injured my neck, I slept wrong. But the neck plays a significant role in lymphatic function. If you look at it from a physiological point of view, it's tied to elevating the rib cage when you're breathing, which is how you move lymph within the body, is how well you're able to breathe. If you have a shallow, rapid breath, then lymph is not moving in your body very well. And then you start looking at the psychological implications of that. You start having anxiety, you start getting stressed out more easily, the startle reflex gets agitated, and you start to startle like easier and easier over a period of time. So there's that component, but there's a muscle in the neck referred to as the sternocleidomastoid, and it basically is these two rope muscles that come from behind your ear, and they attach to the collarbone and to your sternum. And we'll be discussing later today all the symptoms that comes from this muscle when it's like too tight or dysfunctional, where it's developed trigger points. Now, keep in mind that this is probably one of the most important muscles in the whole body. When it's tight, it throws off your autonomic nervous system, which is the balance between activity, or what we would call fight flight, and then inactivity, where we would say rest and repair, or parasympathetic activity. For lymphatic function to function properly, you have to be able to switch out of fight flight and into rest and repair mode. Lymphatic function is not a function that's associated with activity or running and fighting. Like that kind of stuff gets shut down so that you can run better and fight better, right? So you have to be able to shift, your body has to be able to shift into more of a rest and repair mode so that it can detoxify, right? Doing detoxification when you're not really in a good rest and repair mode really is not very efficient. It's not very effective. You really have to deeply relax the body to be able to detoxify. This is why good sleep sometimes is the remedy for a lot of health issues, is because not only are you getting rest, but there's functions that happen in sleep time that don't happen while you're awake, right? And so this can be important. And when this muscle is tight, it throws off this autonomic component. And for those of you who did lymphatic 1, you remember the very first thing that we do is we balance out the autonomic nervous system so that lymphatic function can happen, right? So here we're taking it a step further and trying to put the body in a place to where it is able to easily shift into that aspect on its own, where we're not having to stimulate it, right? And so the key is the throat. The key is the throat. And so now, if we look at it from an energetic point of view, there's chakras throughout the system, and the one that is the big chakra for the lymphatic system is also the throat chakra. You could say the throat chakra is the master chakra for the lymphatic system. If the throat chakra is malfunctioning, then your lymphatic system is malfunctioning. So we have multiple things here that directly impact lymphatic function. And going back to the sternocleidomastoid, there's a series of symptoms, and there's a big list of symptoms that when the sternocleidomastoid is out of whack, what happens to the body? Sinus issues, your eyes get blurry, like there's a whole list. Throws off the inner ear. It actually even throws off your ability to walk a straight line or your gait. I think I've talked about it before, like if this is your feet and you're walking down the line, when the sternocleidomastoid is off, you'll be going like this, and then every once in a while your foot will go. Or you'll notice like you walk a straight line like this. That's all coming from your neck. Like that's not your hips, that's not your legs, not your mind. It's actually the sternocleidomastoid. Now, the sternocleidomastoid also passes over what you call the carotid sinus. And the carotid sinus is the level or degree of blood that gets to the brain. Like it passes over this little area here in your neck that controls the amount of blood going to the brain. And so if you think of like, why is there foggy thinking when lymphatic system is backed up? Is lymphatic system just doesn't back up. There's a series of events that causes it to back up. One of it is a disturbance in the autonomic nervous system. How does the disturbance happen in the autonomic nervous system? The muscles in the neck. Like when the muscles in the neck are off, your whole body's off. So we think of sometimes of a sense of well-being as like, oh, the heart's activated. Yes, the heart's activated, but the neck is relaxed. If the neck is not relaxed, it actually takes away your sense of well-being. Like it makes the body feel like it's not in a good place, right? So unwinding the neck allows you to breathe better, allows you to think better. You're getting more blood to your brain. You're pumping more lymph through your body. And it also is necessary for you to release fascia, which is the connective tissue in your body. It's not the muscle. It's all the tissue that wraps around the muscle, and it's what holds organs into place. It allows fluid and lymph to move through the body, and it allows the nervous system to function better because the connective tissue is wrapped around all these things. When the neck's not functioning properly, that fascia contracts and contracts and contracts, and so it makes it harder for blood to move in the body. It makes it harder for lymph to move in the body. It makes it harder for the nerves to flow to the areas that it needs to go to. And when the lymphatic system is off, remember, it carries hormones to the areas that it needs to go to. So sometimes when somebody has a hormonal issue, it's not that the glands aren't producing the hormones, it's that the package got lost in delivery. Like when you order something in UPS, like we delivered it, but it was to the wrong house and you can't prove it. Like it happens in the body, And so when we start looking at the different dynamics of what the throat does, you can almost say that if the throat is not good, then from a lymphatic point of view, the body's not good. because it can detoxify, it can get hormones. It's the fascia is constricting nerves and blood and lymph as it moves through the body. And I mean, think of sometimes where your body might feel okay, but your head feels kind of tight. I don't know if you've ever experienced that, but most people have some degree of that. They just don't realize it until it's been removed. And so we're going to go through and like in a kind of a fun therapeutic way, we're going to go through and explore these mechanisms as we go through the day. And we're going to do a little bit, and then we're going to go through and we're going to look at how nasty that sternocleidomastoid can be when it's not functioning right, because I have like a list of symptoms, and there's probably 25 or 30 symptoms on there. It's a big list, at least 20. But in just to give you an idea, back in my early days in my youth, um, people did things. My thing is I love to explore osteopathic principles. Like, I don't know, I was such a geek when I was a kid, such a geek. So I used to read these old osteopathic books from the mid 1800s, late 1800s, because my idea was that back then they didn't have pharmaceuticals, so they had to make it work. Like they couldn't just like, oh, take this, call me in a week. It's like, you know, they were having to make things work when there was nothing but some herbs out in their yard or manipulation, and different than what we call manipulation today. They did it more fascially, and so there was two go-to places in the body that, like, regardless of what people came for, it could be a contagious disease. It didn't matter. They looked at two things consistently. They looked at the neck, they looked in the sternocleidomastoid, and they looked at the hip socket. Those were the two go-to things, regardless of what people came into. And then the the thing that there's this one gentleman, he's in the mid 1800s, and he's considered like the father of osteopathy. Um, he referred to the lymphatic system as the spiritual fluid that flows through the body, especially along the spine. And so we're doing a lot more here than just working the lymphatic system, but the beauty of it is you're getting physical relief, you're getting psychological, emotional relief from doing these things, but also you're preparing the body for something like bigger than even just treating the physical body. So, you don't even have to know what that is. Just keep it in your head that something even greater than what we're talking about is happening. And one of the go-to things, regardless of what it was we'd go to the neck and we would treat the neck for a while. And a lot of times things would resolve. And so if you think about like when people were getting vaccinations and they would have the achiness and they would ask for like, what can I take to make the achiness go away? And we consistently said like use lemongrass, right? And the reason would be is it unwound the autonomic disturbance, because anytime you feel achiness in your body, that is lymphatic. Regardless of how it got there, that is lymphatic. Lymph is not moving. So your body is becoming toxic, makes your body achy, right? So even if you try to move the lymph in the area, if the nervous system is off, it's not going to move. It'll move while you're, manipulating it, but as soon as you stop, it stops, right? And so instead of going through this big long protocol, it was like, just take some lemongrass. Lemongrass will balance out the two sides of the autonomic nervous system, and then the achiness would magically go away. It's because the balancing of that nervous system allowed lymphatic function to start happening again, right? And so we're just exploring this to a much higher degree, right? So what we're going to do is we're just going to play with stuff. This will deepen your sense of well-being. It will make you feel better. You'll probably notice that even psychological things diminish a little bit. We're not targeting any of that, but the byproduct is it happens, right? And so with this, we're going to play throughout the day, and we'll do a bunch of Q&A, and you can kind of process it through questions and sharing your experiences. But right off the bat, we're going to take yeah, it says sustained inhalation here, but there is no sustained inhalation. Like if you have spikenard or valerian, um, uh, you can put it in a little bit of alcohol, but here we're using like a body tonic for the ones that got the kit. You're just going to shake it up a little bit. And basically what you want to do is you want to take a little bit, if you don't have a body tonic and you can't scramble around and find a little bit of alcohol or something to mix it in, just take several drops and put it on your fingers and kind of go like this, and then rub it into the sides of your head. Just rub it into the sides of your head. So here, the ones that have the tonic, pour some tonic in your hand, and then just rub it into the sides of your head. Yeah, just like really rub it on there. Yeah, yeah, just go for it. You're really shooting for the sides of your head. So I sit here and give you this big thing about like, we're going to treat the neck and all the things in the neck. And then I'm like, okay, now rub this on your head. We'll talk about why that's the case. Okay. And just by rubbing it in the sides of your head, if you just sit there and you just kind of notice, didn't your body kind of go, like you notice that everything went down, like I was right here, now I'm here, right? So like take one of your hands and then lay it on the side of your head where you just applied it. Okay. Now open and close your mouth. Do you feel something moving as you open and close your mouth? Right? There's all kinds of crazy movement there, right? Right? So, okay, so you can put your hand. So, um, when we think of jaw issues, we think of jaw issues here, right? Jaw issues are actually mostly up on the side of your head. Like they're here too, but a lot of the contributing factor is actually what you call the temporalis muscle. And so when you relax that, for one, if you look at it from an energetic point of view, when you relax that, it allows the brain to absorb more energy. It allows for the pineal gland to activate. It allows for the pituitary to be more activated because you're making space, right? But on a deeper level, if we look at it purely from a physiological point of view, and we understand this best through energy, when you tense your jaw, right? When you tense your jaw, something happens, right? If you look at it from an energetic point of view, what happens is your Ming Men, which is tied to your adrenals, overactivates, which means when your jaw is clenching, your adrenals are starting to get kicked into overdrive, right? When your adrenals get kicked into overdrive, you're not able to go into rest and repair. And if you can't go into rest and repair, lymphatic function just doesn't happen, right? So also when you're in fight flight, there's an increase in body tension because you're ready to put up your dukes and or you're ready to take off running, right? So there's an increase in body tension. So just by applying the spikenard to the side of the head, all of a sudden the body goes, oh, yeah, that was nice. Because the Ming Men overactivates, the front and back solar plexus overactivates, and your forehead overactivates, which means, Have you ever been around somebody and you go, when I'm around them, I feel like I'm walking on eggshells, right? If you looked at them energetically, big Ming men, big solar plexus, big forehead. They're super sensitive, they're super reactive, and their solar plexus is super reactive and agitated, right? So that means that that person is able to go into fight flight at the drop of a hat. Is that how you say that? Drop of a dime. I don't know. One of those things, one of those cliche things you said. It's like that. So by relaxing the jaw sometimes, your ability to reduce tension, anxiety, and balance out the nervous system, sometimes just with that will actually start to happen. So don't underestimate just, I'm gonna, at the end of the day, rub some spikenard or valerian in the sides of my head. And we didn't do the jaw yet, but you do that and you're like, yeah, it feels a little bit better. I did for many years when I would come home at night, I would put several drops of spikenard and I'd go like this and I'd just go, now what was I stressed out about? Because I literally couldn't recall it, right? And so it's just a way to reduce stress, tension, and anxiety. But the goal is to have different ways to balance and harmonize fight flight with rest and repair. So let's do a little bit more on the side of the head. So put a little bit more. Now we know this. Be a little bit generous with the spikenard on the side of your head, but then work in the sides of your jaws, like over here. You see, like here, like rub it in just wherever you feel kind of tension. How you doing, Kadeen? It's so good to see you out here. It was such a surprise. Yeah. How'd you make it out here? You had business or work out here?
Stories.
Oh, stories. Gotcha. Yeah. Uh, we're out here in California, and one of the students from Brooklyn is out here. Isn't it nice?
It's so nice.
It's like even if you just did this like every day, this would have a big impact on lymphatic function. Like what do you notice?
My jaw is just like not tight.
Right. So Robert's here in person, and he's saying that like his jaw is just not tight. And so remember what I said, like a lot of times, I used to specialize, like I did like 2 or 3 years where I specialized just in TMJ, which I don't even think they call it that anymore. But I think they call it TMD, temporomandibular dysfunction, or is that TMS syndrome, something like that. But in the old days, there wasn't all the dental stuff that people do. And so we get in and we do a bunch of manipulation in the mouth. But the big thing is we do a bunch of fascial, like these releases on the sides of the head. And the sides of the head usually resolved it more than the mouth work. And so taking tension out of the jaws, you know, it balances things out, but it also deepens your sense of well-being. And so if you're prone to bruxism or bruxing at night, which basically is a fancy way of saying clenching your jaw, that's actually considered a sleep disorder. It's not just like, oh, I grind my teeth. You grind your teeth and it doesn't allow you to go into deeper levels of sleep because of the disturbance that it causes in the autonomic nervous system. So anytime there's a disturbance, it always will manifest and be reflected in this sternocleidomastoid, in this muscle in the neck. So taking tension out of the jaws actually begins to relax the sternocleidomastoid, right? So you've covered the sides of your head, you did your jaw a little bit. Now in this particular component, we're going to use either helichrysum or Ruscus or vetiver. You can use the blend balance. If you don't have those, you could also use the spikenard and valerian from the previous. So we're going to put our awareness across the whole base of the skull, right? The whole base of the skull, because it unwinds, like it hits a plane of fascia where it unwinds the whole area of the neck and into the jaws, goes up into the head, goes into the low back. So if you want, you can take the oil and put like a few drops on, and then go back there and like rub it in the base of the skull. This is what I call one of those delicious little treats where you just there's ice cream and then there's rubbing essential oils in the base of your skull. And you could say that even this, when you do this, you'll notice that like your neck unwinds, but you notice you're breathing a little deeper, you got a little calmer, and it just unwinds things. And we've talked about this quite a bit in the past, but we're just putting it together in a different way for this particular process this day. So you've applied it to those spots, and just already, before we've even done any inhalation or anything, notice how your head is. Isn't your head like a little quieter? You're a little more relaxed. You feel like it's already going to start off to be a little bit of a better day. Like you're just like, yeah. Where sometimes you're just like, I only have so much juice in my legs to go around the park one more time. Like I just, and you do this and you're like, yeah, I could do it. Some of that is just an imbalance in the nervous system. When that imbalance is there, if you think about it, if you're in fight flight all the time, the byproduct of that is fatigue because you're always on. You could be sitting at your desk, but your body ran a marathon because it's been in fight flight. So sometimes the activity doesn't match the fatigue level, and that's usually neurological. Like something neurological is going on, something's agitated, right? So already you're starting to go, okay, I'm starting to feel a little chill. Like I just did that little bit. I didn't even do the spiker on the back of my head, and I'm like, yeah, I could take a nap. I just woke up, had a cup of coffee, but I could lay down and do a little nappy time, right? It's so soothing. And your body's uh, like that sense of well-being does not happen in fight flight. It happens in rest and repair. So if you're like, I just don't have a sense of well-being, like if you really kind of search it, it's an imbalance in the nervous system. I mean, bottom line, that's all it is. It's neurological. Like you just got to balance it out, right? So now we've done that, and whatever oil you used, begin inhaling it, and then just explore that back of the head. Just explore that back of the head area. You're going across the back of the skull, but like sometimes, like if you want to go a little bit higher or go a little lower, you could do that. Be sure to get along like across the whole backside, like where the skull meets the neck. But there's muscles that still attach a little bit above that. If you want to get in there, if you feel like there's a little like God, there's feels like a little tight spot, take a few drops of that oil and rub it right into that spot. Notice it starts to unwind the neck a bit, but you just as you keep inhaling, it's like keep getting a little more chill. Anywhere where you feel tension at that base of the skull area, kind of focus on that. Okay, so let's put the bottle down and let's do this. Take your fingers. Don't do jazz hands like I'm doing. Take your fingers. I don't know why I did jazz hands right there. And then just start exploring the base of your skull. Like just kind of push in and up and just go, where do I feel tension? Where do I feel like a sore spot? Where do I feel tenderness? Where do I feel like when I push on that, it feels delicious? Even go up on the skull a little bit. Like, where do I feel tension? Like, you don't want to necessarily like slide your finger like this. Like, get into an area and like push up and push down, but your fingers aren't sliding over the skin so much. You're basically just moving the connective tissue around. Like, where do I feel where it's bound up a little bit? And so here's a fun one. So like you have your ear, and if you go behind the ear and like you see where my finger's at, okay? If you kind of poke around there, you feel like a little indention. Like it's about the size of a dime. Like it's just like kind of bloops in, and then you can almost feel like a little band that goes around. Like there is a dense piece of connective tissue there. So take a little bit of the oil and then go to that spot on each side and just rub it in. And then once you're done with that, go ahead and just be still for a moment just to see what happens. And then begin inhaling on the base of the skull and in any of those areas in and around the base of the skull that you just explored. And then just be still. Notice how you feel. Do inhalation again. You know, it's not in the notes, but explore the sides of your head. Not going super deep. You're just exploring the muscles on the sides of your head. And then just be still. Let's try inhaling again. Really try to focus on the base of your skull now. We've explored these different areas. Really hone in on the base of the skull. And then just be still for a moment. Just let it incubate for a moment. How do you feel compared to, an hour ago? It wasn't a stressful morning, I would think. You're getting up ready to do a class, you're hanging out, and uh, I don't know, you kind of wake up feeling how you normally feel, and now 45 minutes later, you feel a little different. Yeah. So this is something that could be kind of a quick and easy thing. Even just the application of stuff on the sides of the head and the jaw can change things if done on a regular basis. But before we move on to the next piece, let's just kind of make sure that we're processing everything that we're doing. I mean, this seems very simple, but it can be a big thing that can impact you. So let's go ahead and share experiences and ask questions, and let's keep it to this process for right now. And go ahead and unmute yourself or type it.
Yeah, go ahead, Denise.
Hey, Denise.
It was heaven. It was a
Yeah,
cranial
doesn't it feel
sacral.
good?
Yeah, it was almost like a cranial sacral session,
Right, it feels very similar to that. Yeah.
truly
Yeah.
very, very impactful. You were really right when you suggested this one for me. Thank you so much.
Yeah, you're so welcome. Good,
I'm
good.
looking forward to today. Thank you to
Yeah.
both you and Sam.
You're so
Okay.
welcome.
And then go ahead, Linda.
Hey, Linda.
Hey, good morning, Greg. This is like exactly what I've been asking for the last few days, because I've been having a real trouble sleeping for years, probably at least a
Mhm.
decade. And I wake up and I'm like agitated down in my lower body and I can't get back to sleep. I can't calm things down. I can't.
Right.
You started talking about the jaws, because I have a terrible problem with my jaws.
Yeah.
And
Yeah.
it was like, yes, this is exactly what I need.
Yeah.
And interestingly enough, last night before I went to bed, I said, okay, we're gonna figure out what's going on in my body before I go to bed. And I scanned, and my Mingmen was just gigantic and overactive,
Right.
crazy. And when you said that this morning, I was like, oh my God, see?
And it's a very interesting thing because like when we look at like from the point of view of like different conditions, we can kind of see like how the body responds. And like when you look at pain syndromes, actually what starts to happen, you lay down at night and like the pain is kind of more in your face at night than it is during the day, because during the day you're in movement, you're in action, you're a little bit distracted. And so what starts to happen is that a person in pain, when they lay down to go to sleep, will start to have like almost like a phobia about going to sleep, because it's like, I don't sleep good. I'm not going to be restful. I'm going to be way more aware of my pain. All these things that kind of start running through their mind. And so one of the things that happens is they almost start to get anxiety at night going to sleep. And like you said, you go through and you start scanning the Ming Men at night, you would think that, oh, I'm going to be super chill and lay out, but sometimes it's just the nervous system can't shut down. And so you're going into a place of like, okay, I'm going to rest and let my body repair. But if your body's in fight flight, your body goes, that's a vulnerable thing to do. Why would you do that? Like you're putting your guard down. You can't run, you can't fight, like you can't do any of those things. And so your body almost gets like extra stressed out when you lay down and you try to go to sleep. And it's not psychological, it's not emotional, it's not mental. It is literally your physiology. And it's like when you're in fight flight, certain things get flicked on and flicked off, right? And then when you go into rest and repair, certain things get flicked on and flicked off. And if you're in fight flight when you're laying down to rest, it just doesn't flick those switches the way that it should. So like you're laying down and you're like, your body's still going, yeah, I still have to run. I still have to fight. It's not a conscious thing you're thinking of, but your body's nervous system is in that place. And so it will manifest in like bad sleep, poor sleep, like any of those. And so like you did real good, like measuring your Ming Men, you can kind of tell like, because that would be an indicator of, okay, I'm in fight flight, it's the adrenals. So going through and rubbing this on your head, you could even add like taking a couple drops of spikenard internally. And like the jaw, if you want to unwind it, like sometimes what I have people do is either put like a couple drops of marjoram or spikenard and then just rub it like on the gum lines and back on the muscles in the jaw just to try to relax the jaw even there. So do it topically here and then do a little something on the inside of the mouth. And relaxing the jaw will probably help you sleep better.
Yes, it will. Thank you so much.
You're so welcome. Now, let me know how that goes, Linda.
Okay.
And then go ahead, Tracy, then Peggy.
Hey, Miss Tracy.
Hello, good morning.
Hey, hey.
So, I'm the problem child here for this whole protocol. This is perfect for me. And we were at a huge convention the last few days, and we have employees that are, let's just say, trying at times. So, I mean, I didn't realize how tight my jaws were.
Yeah.
Like flying home on the plane, the longest leg, my ear just started hurting. And I normally chew gum and it never bothered me, but this time it was just so painful. And like I could feel as we put on the spikenard that the ear starting to kind of unwind a little bit.
Yeah.
And then when I went behind it with the helichrysum, it was like my ears went, ah.
Yeah, isn't it nice?
Yeah, it's very nice.
Yeah. Yeah, the ear, like as the day progresses, should get better.
And I'm also putting it on Brian too, so that's helping him.
Oh, good.
Yeah, which is nice. Thank you.
You're so welcome.
And then go ahead, Peggy, then Ralph.
Hey, Miss Peggy.
Hi, y'all. First of all, thank you, Tracy, because my ears blow up every time I fly. And hearing you say, do that, wow, that might be my answer. And as far as this protocol, I'm always relaxed. I'm just fought to stay awake. I'm so relaxed. I dropped the bottle 5 times. Just what a way to, you're supposed to do that at the end of the day, Greg, and then we go right to sleep. So you're going to have to do something to like wake us up. Thank you for the relaxation.
You're so welcome.
And then go ahead, Ralph, then Deborah.
Hey, Ralph.
Hey, Greg. Well, I was quite relaxing. Thank you.
You're so welcome. Hey, how did that help you? How did that help your jaw?
Quite a bit
Okay.
relaxing. Matter of fact, I got carried away and slathered some of that spikenard body tonic on my neck, both sides of my neck, because my neck has been, I've been aware for a long time that my neck has been tight.
Yeah.
So
honestly, almost everybody's neck is like to a different degree, like, but you have injuries and things where your neck has gotten, much tighter, but like,
Yeah.
yeah.
So I'm not gonna cause any big problems if I regularly slather the spikenard body tonic on my
No.
neck? Okay.
No. And even later today, we slather it on your neck, so,
Oh, good. Yeah, I'll take a
yeah,
second round. Thanks.
yeah, I figured you would.
Okay, cool. Thanks.
You're so,
And then go ahead, Deborah.
hey, Miss Deborah.
Hey, Greg and Sam. So, all of your suggestions for my surgery were excellent. And the reason I bring it up is because this is all related to grinding my teeth, which I have been
Oh,
doing.
wow. Yeah.
Yes, I've been grinding my teeth at least since I was 5 years old. And
Mhm.
so, lost one tooth on one side, and now I've just lost the other one. So, and then the whole thing about not having good sleep explains so much. I wake
Mhm.
up with my knees in like up against my chest almost, like but while I'm laying down. So it's not like a fetal position. It's more like my whole body's tense. That's
Mhm.
happened frequently. So my question is by doing this procedure before I go to sleep on a regular basis, I could start to re-educate my body, you
Yeah.
think?
Yeah. The more that yeah, that's a very good question, very good way to look at it, is you're trying to re-educate the body. And the nervous system, once it kind of goes down a pathway, like you're talking about, like you've had something going on since you were young. Once it goes down a pathway, it never goes like, okay, let's not do this anymore. We'll do something different. It's just like, this is what we do now. Like, it's just, the more it does it, the more it becomes ingrained that this is how the body functions. And it doesn't matter, like the nervous system isn't really judging good or bad. It's just adapting, right? And so what happens, you see this like in whiplash syndrome, or like injury syndromes, where the body starts to go down this weird rabbit hole, and you have to re-educate the nervous system to pull it out. Just even treating symptoms isn't enough. So we come back to your grinding. And I would say, doing this, I really like the idea of putting marjoram in the, like, on the jaw muscles, because it does a couple of things. Like, for one, marjoram's relaxing. For two, it's antispasmodic, and so it takes some of the tension out. But it's also one of the better oils to tone the vagus nerve and parasympathetic activity. So you're kind of taking tension out, while at the same time you're treating the part of the nervous system that helps it to shift in a place to where that tension can start to diminish. And so you can always augment with a little bit of magnesium, like 500-600 milligrams. Again, it's not going to fix it, but it takes the edge off of it. And if you want to increase the dosage, you can't just keep increasing magnesium, because it'll give you like a loose bowel movement or something. So you can, after about 500 or 600 milligrams, I'd like find alternative sources. And there's an herb called wood betony. You'll have to find it and get it in capsule if you run it down on Amazon, because it's not something you'll ever find in a health food store. It's very old school, but it's really super high levels of magnesium in the herb. And it's a way to get substantial amounts of magnesium over a period of time. And keep in mind that if the magnesium is low, the body is prone to a bunch of things, but one of them is like contractures and spasms. It takes at least 6 to 8 weeks to raise the magnesium serum levels in the body. So just taking it for like a week, it's nice, but it's not going to really do something until you take it at least 6 weeks. And so, like, I'm on a little regiment right now just for maintenance, where I'm taking magnesium like every day for, like, I'm shooting for 2 months, 60 days. And, I do it like maybe once a year, or if I'm starting to feel like cramps and things in my body kind of often. So it's good for heart health. It's good for muscular health. It's good for so many things, so many processes. But think of like Jaws and Bruxine as like there's multiple factors to it. Like, we usually don't find one thing that resolves it, but you just start unwinding it. And, my rule of thumb is I don't throw everything at it all at once. I do something for a little while, and then I do something else, and then I do something else. I just keep unwinding it. And so doing this on a daily basis, like you said, will help you sleep. It help you re-educate it. It probably will need to have something else to augment it. But, doing the marjoram inside the mouth or the spikenard, that will be helpful. And then just even taking out some of the body tension or the neck tension that we're going to do later today will also contribute to that as well. And so just keep the idea of you're just going to be unwinding this for a while. Yeah, especially since you've had it since you're 5. But honestly, the nervous system could have gone out of balance, and then just that's the way it was until you unwind it. And so, a lot of things that we struggle with later in life are things that got set in motion in our youth. We were young and it wasn't that big of a deal then, but just over a period of time it accumulates, and then and so yeah, that's a great way to look at it. Yeah, a great way to look at it.
And now there's so many more people like you around to help us know what we should have done as a kid. And now we're
Yeah, even 20 years ago, like the jaw thing was not a thing. Like people, like when I was doing it, like it was probably, oh God, like I'm getting old, 30, maybe 25, 30 years ago. We had to educate people that they had a problem, which seems weird. Like you just have to go, does your jaw hurt? Do you have pain? Do you get a headache? Does it click? Does it, do you have a hard time chewing? When you chew, does your jaw pop? Are you having, we just have to ask all these questions, and then we'd go, you have a jaw problem, and then go, what? But like, cause let's have everybody do this. Like just sit in your chair like this and feel how your jaw is sitting in your mouth. You're just sitting in your chair. You notice like, okay, it feels pretty even. Now, elevate your shoulder like 3 or 4 inches and just leave it up there. Now, feel what's going on in your jaw. Like you feel how that shifted and changed in your mouth. This has nothing to do with your jaw, except this is the most adaptive joint in your body, the jaw. So if there's problems with, especially with alignment going on in other places in your body, you feel it there. If there's too much posture forward or back, or you're compensating when you walk, you feel it in your jaw. So it's not always a jaw issue. That is it could also be a body issue. So it's not always a clear path to unwind it. Bruxine is usually just a nervous system thing. You can unwind the nervous system in a bunch of different ways, but if there's like a lot of tension in the jaw, and you just keep unwinding the body, you keep doing the things that we talk about all the time, and it keeps unwinding the jaw itself.
One quick little clarification. So
Sure.
we put marjoram inside, but not spikenard. Is that correct?
Yeah, sure.
Spikenard-
Yeah. You could do spikenard. You could do valerian. You could do vetiver too. But I usually I do either spikenard or marjoram. Marjoram I like just because spikenard is antispasmodic like marjoram, but marjoram's a little bit better for blood flow and pulling the body out of fight flight into rest and repair. it can be a little bit of a better choice in general, but sometimes if margarine, you're not responding, spikenard is just deeply, deeply relaxing. Spikenard and valerian are very closely related. And like we were telling you in the email about, I don't know, I went off on one tangent about how, you know, they have synthesized valerian in pharmaceuticals, and it used to be what they would treat, Valium is what they used to give for anxiety, but it's also what they used to use as a muscle relaxer. Like, so back in the 70s and early 80s, like if you had spasms, they didn't give you the muscle relaxers that you know now, they just gave you Valium. And it's just because it's like spikenard or valerian, it's just the synthetic version of it. And so, you know, it helps with sleep, it relaxes the muscles, it calms everything down. And spikenard and valerian, especially a little bit more valerian, they're like a restorative to the homeostasis mechanisms. Like if the body is a little out of whack, it just kind of calms everything, and like you could call it, like esoterically we might say grounding, but it's just it normalizes your drive for balance. You know, when the body is not in homeostasis, it starts making these trades in the body, and like the first things on the table are blood pressure and blood sugar. And so when there's a blood pressure or blood sugar issue, it's not always about the heart and it's not always about the blood sugar. It's that there can be these agitations and homeostasis. So it's like kind of grounds the homeostasis mechanism. It regulates it. It's like it's a restorative, so that it stops doing all these weird like trades in the body, and the body just keeps going out of whack. When it starts making all those trades, we would see it as like the downward spiral. You know, your health just starts going downhill, you know. And so yeah, I mean, you can use it as a tonic to just maintain like where you're at, you know, improve where you're at. You know, it depends on where you are and what's going on in your life, but you know, or in your body, I should say. But yeah, I like your plan.
Thank you very much.
Yeah, yeah. How did your dental thing go, by the way?
Amazingly well. And a lot of that I attribute to your advice with the spikenard. I didn't have
Yeah.
valerian, but I have it on order for next time.
Yeah, yeah. Spikenard and valerian are actually very, very similar in nature. Like, you know, the chemistry is slightly different, but I like them both for different reasons, but they're kind of interchangeable a lot of times. For a restorative, valerian's a little bit stronger, and I think sedative wise, valerian's a little bit stronger, but you know, it is what it is. I mean, spikenard worked for you, right?
Oh,
Like
it was amazing. Yeah.
Yeah.
Thank you.
Yeah, perfect.
And then go ahead, Denise, then Teresa.
Hey, Denise.
Hi. So like I do wear glasses, and I imagine, you know, many of us do. I noticed that, you know, it does put pressure, like acupressure, almost on the back of your skull constantly in that area. So I am really very sensitive to that. This helped that so much.
Oh yeah, it should. Yeah. I know exactly what you're talking about. Yeah.
And then would it help the muscles behind the eyes as you're trying to relax at night? Because that's where I noticed some real tension, is a muscle behind that left
We
eye.
will address that later today. Like one
Excellent.
of the things with the sternocleidomastoid is it will cause spasms in the muscles around the eyeball.
Oh, that's going to be great.
Yeah.
And then if we have an accident or injury, then we kind of would sort of need to kind of go in and unwind and reestablish those lines back, right? It helps us heal
I
quickly.
would say unwind it just because of life. Like, you know, the way you sleep, and you know, it's so funny. Like, you know, when you're young, you do something, you go like, how'd you hurt your back? I was like, oh, you know, I was running up these stairs, I had a box on my shoulder, and then as you get older, you're like, how'd you hurt your back? I sleeping. I was sleeping. Like, you know, it doesn't take much, you know. And so I would just say, like, life happens. And so just like you would take care of anything, like really take care of the neck, like just keep unwinding it. And in fact, in acupuncture, it's such a critical thing that a lot of times you'll see acupuncturists, they'll wear like a scarf around their neck. And it's usually a silk scarf. I mean, it's not quite the reasons that we're talking about, but still, it's about taking care of the neck, keeping the neck warm, keeping everything functioning in the neck in the way that's proper because it's tied to your overall health.
I can believe that, truly.
Yeah.
Thank you so much.
Yeah.
And go ahead, Teresa.
Hey, Teresa.
Hey, Greg.
Hey.
That was great.
Hey,
In
good.
fact, I guess I'll share an experience and then I have a question. So,
Sure.
as we started working on the points, the indentation points behind
Mhm.
and in the back, I could feel like light fly right down my spine to my basic and
Yeah.
even get my feet.
Yeah. Like especially when it's really like kind of wound up there, it's actually a trigger point, and it can cause like tension to like radiate through your whole head, but it will tie to the spine just like you said. And people that have like headaches or even migraine sometimes, that can be a spot. I've even have corrected some eye issues sometimes by correcting that spot.
Sure.
Like there's just all kinds of things, things in the jaw. It's one of the things that we would look at when we were treating whiplash. Like, you'd unwind the neck and all these things, but it would be like a secondary thing that you would go look at because, whiplash, it's in the neck, but it starts to go up over the head and around. Like it just, it keeps radiating. And so we would get in and we had like special maneuvers to go through and release that spot. And sometimes it took several sessions. It wasn't just like a quickie, it was something that you really had to unwind, but it will change the dynamic of the jaw and the head and the movement of the cerebral spinal fluid circulation in the brain.
Yeah. And is that trigger point across the gallbladder channel? Do you know?
Oh, I'd have to look it up. The meridians are my forte. Like I have a chart, but
Sure.
I'm not sure. Yeah.
Okay. And then any thoughts of why what I could feel is a sensation on the insides of my ankles, like a pulse. I could feel a pulse come through. Any thoughts to the, obviously
It could
everything.
be like because you're still, even with that spot, you're still unwinding what you would call the nuchal ligament. And there's whole osteopathic practices that's just what the only thing they'll treat, the nuchal ligament. It's that spot, it's the spot across the base of the skull, and it unwinds the neck and the upper torso so much that it can actually continue to go down the spine and in the legs, because your connective tissue is like, it's not like these separate pieces. It's like you took this big giant napkin and you kind of crushed it and compressed it, and then you did this to it, and then you made it look like your body, like it's all connected. So you can release something in your head that then releases something down in the pelvis or down in your legs. And this is a kind of, will show you like when I had different specialties through the years, and one was trauma, like psychological traumas, like when somebody would go through a traumatic event, and like abuse or something like that. And we'd get to a certain point, and as far as being able to like pull out the traumatic energy or get them to release the traumatic energy, we'd hit like a stumbling point. I would go to the feet, especially the heel, and I'd unwind the fascia in the heel, and the trauma would just come pouring out of the emotional body. And people would always say, "Is my trauma stuck in my feet?" I'm like, "Nope, it's the fascia is how you hold that stuff in."
Mhm.
And we've unwound the fascia all up in here, so we got to look for weird places where it's wound up. So I'd go to the heels and I'd just like unwind the heels a whole bunch, and it would just pour out because the fascia gets really bound up in the heels. I was like, that's an easy place to look.
Yeah.
And they'd have big emotional releases because of the thing that I would do on the heel. And so when you start messing with fascia, it opens up how the nerves work, how the blood moves, how the lymph moves. It opens up meridians, it opens up all kinds of things. Anything could happen once you start doing that. Any sort of fascial work, anything could happen. Yeah.
Yep. Perfect. Felt great. I'll keep doing
Yeah.
it.
Good.
Thank you.
Anybody here want to share? I have some in chat, but just wanted to check, make sure.
Yeah, that would be two things.
Yeah. Kitty.
That was my first thing. You mentioned that the spikenard, right?
Mhm.
Tonic, helps with the menu, right? So I guess does that mean it can help also with blood pressure? Reducing it?
It can a bit. So he's asking the spikenard, putting it on the side of the head. It can help the Ming men. Can it help with blood pressure? It can. Blood pressure can be a little bit complicated. There's a lot of different reasons why. Um, Best thing you can do is like start just treating and see if it works. But the thing with blood pressure, it could be fluid retention, it could be like things to do with calcium, it could be this is a weird one, and it's something that gets overlooked quite a bit, but it can be tension in your veins, can be cardiac fatigue, and so I would say my first go-to things when treating blood pressure is the use of a diuretic. Basically, if you have fluid retention, you're going to have more fluid volume to move, which causes the blood pressure to elevate. So, first rule of thumb is start using a diuretic to reduce blood pressure. Then the second thing is I like to use like venous tonics. Anything that supports the veins, and that will reduce the blood pressure if it's tension in the veins. So like things like cedar and things like that are all good, but usually I jump to the herbal world, and I do a combination of gotu kola, and then what is it? Is that citrulline?
I'll double check.
Yeah, it's like I think it's L-citrulline. And L-citrulline literally takes tension out of your veins, especially if how there's the two numbers in your blood pressure, especially if the second number is higher, the L-citrulline will drop that number a lot. Like, because what happens, like high blood pressure is bad, obviously, but what's even worse is when the second number starts to get close to the first number. Like there needs to be that ratio of kind of 2 to 1. Like a 120 over 80 is like good. 120 over 100, like it's still relatively low except for that one, but that ratio, that starts to be more of an issue. And that is usually vein tension. And so if you can reduce the vein tension, then actually the blood pressure is easier to manage, because then you're just dealing with a higher first number. Then you go to like Melissa, Neroli, Lang Lang, Anula, something usually there will drop it. But if you have that vein tension, it can be really hard to treat. Even the use of vein tonics, that combination of gotu kola and the L, I think it's citrulline.
Yeah, I looked it up. It is.
It's very cheap. But I mean, it's like you got to take like
Mhm.
5,000 milligrams. I mean, you got to take big doses, not just like a capsule cuts it. You're taking, 3 to 5, and sometimes in severe cases, even 8,000 milligrams of the L-citrulline.
Wow. Okay.
Yeah.
And then I guess the Melissa Lang Lang, you would use that where?
Internal.
Mhm. Okay. My second thing is when we started doing the inhalation, I was using helichrysum. focusing on the
base of your
of
skull.
the skull.
Mm.
And afterwards, I was like, oh, I feel very uncomfortable now.
Hmm.
Like emotionally, like, like is something being released?
It's probably something being released.
Mhm.
Right.
Got it.
Right.
Okay, thank you.
Yeah. I was trying to think of a joke real fast, but I was like, yeah, getting old. I'm like, don't have anything to come back with.
Okay, thank you.
Yeah. I mean, it's always like, again, going back, because he was saying, like, as we unwound the base of the skull, he started feeling a little bit uncomfortable. Like, some emotions can come out, but they'll usually pass very quickly. Like, do you still feel uncomfortable or?
Slightly, but not as much as before.
Okay. So he said it dissipated. It's still there a little bit, but anytime you mess with the fascia, things will just like kind of flow out of you. And the thing is you don't have to make anything happen. It's leaving. But sometimes there might be like 5 minutes where like, oh, that was weird. I don't know what that was. You don't have to figure it out. It's on its way out. It's something that was trapped in the body. Sometimes it's just agitation leaving. It's not even about a story or an event. It's just leaving. But that is the clinical term for it. Just the
Thank you.
So some shares,
Mhm.
definite tension reliever.
Yeah. Yeah. And there's all different kinds of ways that we can relieve tension. This is just a nice one that's easy. You could do it right before bed. You could do it like when you don't feel good. You can do it like there's this old medical aromatherapist that's a buddy of mine that, whenever we get together and we just chat, we always end up chatting about medical aromatherapy because that's what we do, right? And we both did some version of like coming home and just putting several drops in, then just like rubbing it on your head and then just ugh. And he used vetiver, I used spikenard, kind of very similar, but the other one you can do that with sometimes is aloes, if you wanted to be fancy. Mm.
I'm just getting over COVID and the worst symptoms were headache and throat soreness. Now I can actually feel a spreading relaxation at the back of the head and my sinus feels more open.
Yeah, and so going back to anytime you have a cold and flu, that is also disrupting the autonomic nervous system. So, it could be a thing that is not necessarily used to treat the virus itself, but will undo the effects of the virus on the body. Think of the virus as a really cheesy rock star from the 70s. When they're there, they trash the hotel room, they throw the TV out the window, they set something on fire, they do, a bunch of weird things with mustard all over the curtains, they ruin the place, right? That's what a virus does to your body. After the virus leaves, a lot of times what we're dealing with is the after effect of what the virus did to your body. The virus can be gone, but it just trashed the place before it left. And you just got to go through and start making things right. And one of the things you make right afterwards is um, balancing out or fortifying the parasympathetic activity. Remember when I said that, like when you're in fight flight, the byproduct is fatigue. Think about what happens after you get through the cold and flu. What do you feel? I feel tired. I feel worn out. I feel your body's been neurologically out of balance for a while.
Question on the L-citrulline, is that 8,000 milligrams per day?
Yeah, I would probably do 3,000 to 5,000 milligrams. I mean, it sounds like a lot. Like if you buy it right, that's probably only like 2 capsules. But if you get like capsules that are really small in size, you might have to take more. But like you can buy capsules of L-citrulline that are 2,500 milligrams a piece. So you end up taking 2 for 5,000 milligrams.
And then how many times per day?
Once a day.
Is that why I suddenly feel a bit sad? The release? My temples feel a bit tight.
Probably, yeah, yeah.
I'm feeling tension where I didn't when we started.
Tension where?
The temples.
Oh. Maybe rub some more spikenard in the temple and the
They
whole
even
side.
said the whole upper side of the head.
Yeah, yeah.
Where do we apply in the mouth when you were talking about?
Like, you know, where you go to where the jaw hinges, like put a couple drops on, and if you open your mouth and you go back, like past the teeth, you'll feel this like big muscle kind of coming down. And when you touch it, it almost feels like it burns a little bit. It's so tight that it has like a burning sensation. Don't put a lot of pressure there. There's just probably about the weight of a nickel and just kind of rub it up and down. And you know, you got to kind of go in and go back and then like up against the muscle, like so you're going in and then pushing to the side. And yeah, when we're home, I can show you on the skull, the skeleton skull. I can show you much easier on that one, probably.
Okay.
Yeah.
Will that ever help with chronic arthritis in the neck?
Depends on what kind of arthritis we're talking about. Usually, are we talking about spurring, or we're talking about a reduction of cartilage? What are we talking about? There's arthritis is a whole bunch of different kinds of arthritis, so each kind has to be treated.
You could type in or you can unmute yourself. Yeah, there you go.
Hey Greg, it's Danelle. So yeah, I have rheumatoid arthritis over 20 years. So yeah, there's that decrease in cartilage in the neck area for sure.
I would use joint relief on the neck.
What is it called?
Yeah, yeah. Physically, like rub it on the neck. Yeah.
Joint relief.
Joint relief.
Oh, joint relief. Okay, yeah, I think I have that one.
Yeah, that's one of the best ones to treat rheumatoid.
Oh, okay, thank you.
Yeah. Your hands and feet are okay though?
The right hand and a couple of the fingers are not good. My feet are better because I had a surgery about 3 years ago.
Put joint relief on the hands as well.
Hands as well, yeah. Okay, thank you.
And back to the L-citrulline, would it be combined with L-arginine?
No, by itself. It needs to be by itself. Yeah.
And I'll
So
make sure.
let's go ahead and take a break, and we'll take a break and we'll come back and we'll do the next phase. So let's see. Next phase is, like, I was going to give you the oils to get ready for the next phase are any of the different kinds of sages. Clary sage doesn't really work for this, but if you don't have anything else, you can use that. Lavender and lavandin will actually work. And for those of you that have done the mystical healing class, Violet Healer would also work. So go ahead and pull out one of those, and we'll see you at a quarter till the hour. Hey, everybody, let's come on back. So we are now looking at what we would call the energetic state of the body. And, you know, just like we worked on the head, we relax the head, it kind of relaxes the body. When there's tension in the body, the neck has to work harder to elevate the rib cage, to do breathing, to do all the things that it does. And, you know, as we kind of did that little examination of the jaw and then the body misalignments, you know, you could say that's a kind of tension that will manifest up in the jaw and then the neck. So this next piece where we talk about the energetic state, we're going to treat the feet and the kidneys. And if you're anything like me, you'd be in a place where you'd go, I thought we were going to talk about the neck, and now we're working on the feet and the kidneys. But think of it like this. If you can reduce tension in the body, it takes tension out of your neck. sometimes the tension in your neck is not just because your neck is tight, it's because there's other things going on. So when you want to shift the body substantially, like from being in a stressed out state to a not such a stressed out state, being fight, flight, or whatever we're talking about, one place to do it is at the head. The other place to do it is at the feet, right? So if you work the feet and relax the feet, then the rest of your body goes, oh. Now, why the kidneys? So in your energy anatomy, we have the aura and we have these health rays that are like these little perpendicular lines that go out. And we've talked about how the aura and the health rays play a significant role in neurological function, right? And then you have the chakras, which are little energy pumping stations that the meridians are kind of off of, like the meridians are directly attached to a chakra, but they're like how it kind of manifests in the body, right? So the chakras are constantly absorbing and expelling energy. They're constantly kind of moving back and forth, right? And so they each have specific functions and specific jobs that they do in the body, in the emotions, the mind, and even in your spiritual development. Now, the chakras, like if I'm talking about the heart chakra, it's not on the body, it's out actually away from the body, and it comes into the body like a cone or a funnel, right? So the surface might be out here, but it comes all the way into the spinal cord area, right? So it comes all the way in like this big funnel. So in between the surface of the chakra and the surface of your body, there's this little thing that they call the protective web, right? The protective web. And the protective web is just like you could say the way that your energy body protects itself in the environment. It keeps like the little nasty energetic critters that are like little cockroaches from getting in, or your boss exploding and being super angry at you. Instead of it going directly into your energy body, some gets in, but some gets filtered out by this protective web. Now, what happens is when somebody projects something negative at you, the protective web goes, let's tense up to not allow it in. Like I'm going to firm up so that nothing can come in. So this also is tied to you going into fight flight. You have your physiological issues, but energetically, part of how you go into fight flight is how much tension is in these protective webs, right? How much has that protective web tightened up and then taken the bombardment, and then the bombardment stops and the body goes, yeah, let's just keep it that way. They might come back around again, right? So these protective webs directly impact your immune system and your nervous system, specifically fight, flight versus rest and repair. It's not something that you would be aware of, but it's something that does happen. And so each of the chakras has a protective web. Instead of going through and say, let's treat all the protective webs one by one, you can go to a source where you can affect all the protective webs at once. And that source is the kidneys, right? So when you kind of put your awareness on the kidney, you're relaxing and taking the tension out of the webs themselves. So, you have that tension that comes from your boss and you shake it off or whatever, but you still feel like there's still a little something there, right? We all got it. Now, it keeps energy out. It also keeps energy in. So when they're really tight, you're reducing the amount of energy coming in, but you're reducing the amount of energy that you can expel off. Right? So like if you were holding your breath for a while and your lungs were full of air and you go, okay, now I need more oxygen, I'll just breathe deeper. Like that's equivalent of what we're talking about. Like if the webs are really super tight, your energy body is really congested, your ability to draw in healthy energy from the environment is reduced. Your ability to kick off that lower vibrational energy or that used up energy is also reduced. Then emotions also become more like impacted. It's not that we're repressing it, sometimes it just doesn't have space to come out, right? So again, by opening up the webs, it allows things to just kind of flow through you to a much higher degree. If you want to gain deeper levels of perception in something, your webs have to be in a good place. They can be super, super tight because you can't perceive really outside yourself without it. It acts as a veil, right? So if you relax it, you can pierce the veil. If it's tight, it's hard to pierce that veil because it's so rigid, it's so tight, right? So you could say your ability to see outside the box is tied to partially to the health of your protective webs. So this is a very simple way to go through and treat this component. So you have all these different sages. You have lavenders, lavandins, sitka, spruces, and violet healer, sage supreme. So whatever you have, let's pull it out. And if you want, be a little extra fancy and put it on your feet, especially between the toes. Like if you see me like this, you should take a little bit, like put it on here and then rub it between the toes like this. You're just rubbing it in. This hits all the meridians. Which feels good, yeah. You can also put a little bit on your heel if you want, just because, if you're feeling fancy.
Yes, 12 feet.
But yeah, both feet. Mm-hmm. Yeah. It's doing something a little different, but yeah, same idea.
Bottom of the heel or sides of the heel?
Yes. Okay, so you're all oiled up there, and begin inhaling with whatever oil you chose. And your awareness is on your feet and the whole foot, the tops, the sides, the bottom, the heel, the toes. Just take some long, slow, deep breaths with your awareness on the feet. Your awareness is on your feet. You're taking nice, long, slow, deep breaths. And then just pause and be still. Notice how you feel. Your body, notice your neck. Begin inhaling. Your awareness is on the feet. You're doing that same process again. And then just be still. Pay attention to your body. Like, what do you notice in your body? What do you notice in your neck? Now your awareness is on your kidneys, your low back area. You're taking nice, long, slow, deep breaths. And then just be still. Again, begin inhaling. Your awareness is on the kidneys. And then just be still. Just let go. Notice how you feel. What do you notice about your body? What do you notice about your neck? Go back to the feet. Take some long, slow, deep breaths with your awareness on your feet. And just be still. Go to your kidneys. Long, slow, deep breaths with your awareness on the kidneys. And then just be still. When do you notice?
Strange one. When I stop smelling the sage supreme, I could then smell anise. Every time.
I have anise in there. I don't know if that's what it is.
What do you? Whenever we do something like this, Samantha has a special mudra that she gives me. So you notice your body is more relaxed. In a more relaxed state, for when you're shifting your body over into rest and repair mode, but your rib cage is now easier to elevate, which means you're taking pressure and tension out of the neck. Anytime you take pressure out of the body, you're taking pressure and tension out of the neck. And we're not like going through and covering the whole body, we're just hitting hot spots. But you notice like your neck kind of not as achy as it was before, right? We really haven't done anything to the neck quite specifically, but it's like the neck, just like when we elevated our shoulder, is a byproduct of everything going else in the body, and it manifests up in here. So just to treat it here doesn't always produce the desired result. So here we did the head, we did the feet, we did the kidneys, and you start to go, yeah, my neck's maybe not 100%, but it's feeling a little better. Like, this could be good for the day. Like, you know what I mean? Like so let's take this same idea and now go directly to the neck. So you're using the same oil that you just did. You're using the same exact one. And we're going to do inhalation, but if you want to be fancy and a little sassy, put a few drops. I don't know why sassy is my new word, by the way. Last 2 weeks, I'm like, everything's sassy. Right? You put a few drops there and then rub it on this spot where the neck and the shoulder kind of meet. Right? If you poke around, it's where it's tender, that's the spot. Like in some point systems, they refer to this as the suprascapular point. Just means like the upper scapular point. So it's just that spot where you can push around, you go, oh, there's so much tension right there. That is the source of a lot of headaches, by the way, is that spot. So you're taking some of the tension out of the neck and shoulders just by working that spot. Like if you put some there and then you move your neck around, you're like, yeah, it feels a little better. So like here's the key. Like if you have a little bit of pain in your neck and shoulder, like say you hurt over here, right? And then you turn to the same side and it stays about the same, but you turn to the other side and it gets worse. It's these points. It's exactly these points. If it hurts when you turn to the same side, it's something different. But so these points will cause a lot of neck issues just because they're tense, they're activated, whatever you want to call it. Okay. So now you've done that. Begin inhaling the oil, and your awareness is on the top of the shoulders, like this whole area. Like this whole area, like this. The neck across the whole top of the shoulder. Go into those spots where you just were digging your fingers. Okay, now move to the front of your neck, the whole front of your neck, from the top down to the bottom, just the whole front side. And then just pause and be still for a moment. Just pause and be still. Kind of relaxing, yeah. Now, begin inhaling, and your awareness is on the sides of your necks. Necks. Apparently, I've been inhaling secretly, and I'm like super spacey. Neck, the sides of your neck. And then the back of your neck. You're inhaling on the back of your neck. And just be still. Just be still. That's right. That's about how's your neck?
Getting better.
How's your neck? Yeah. Yeah. So we're kind of like with this little process, we're prepping for the deeper work that's going to come after lunch. But I just did a little like tally here, and everybody, your neck's unwinding. The key is to just not always be focusing on the neck. We tend to think very symptom oriented, especially in the West, where we go, it hurts here, let's focus on this. But if you look at some of the things that contribute, you start unwinding that. When you go and treat the specific area, you get much better results. So it's not like an either nor. It's like, let's use them together, but let's use them in a way that's sequential. So one builds on the other so we can produce the results. You're basically working like with movement. If I do this, then this can happen, then this can happen, then this can happen. So we tend to look at things like very like this is my neck. We don't look at all the dynamic activity and movement that the neck does and everything that it requires. I mean, not just the neck, everything. I mean, it's the way we think in the West. So we did the base of the skull before. We're doing it again right now. Your awareness is on the base of the skull. Taking a long, slow, deep breath. Long, slow, deep breaths. And just be still. Now, pay attention to your neck and just explore, where do you feel the most tension? Where do you feel the most anything in your neck? Agitation, front, the sides, the back, even the tops of the shoulders. Where do you feel it the most? Wherever that is, you're not even inhaling yet. Just put your awareness on that area. Like sometimes when we have pain, or a tension, or an area that's like got a glitch in it, whatever word you want to use. When we have an issue in an area, we kind of wrestle with it, or we try to make it go away. And think of it like this: when you allow it to be, it stops having control over you. So when you have that glitch in your neck, you go, okay, I'm just going to sit with it. I'm just going to observe it. And then pretty soon, your body starts unwinding because you're not trying to control that spot. If that makes sense. So just sit with it for a minute. This is what we do in Lama Yoga. We do sustained awareness, where you put your awareness on your body and you're checking in with something and you're allowing it to be, so that it unwinds and it doesn't control you anymore. You increase your awareness, your perception, by reducing the tension or resistance to something. Now begin inhaling the oil with your awareness on that spot. And then just be still. Notice how you feel. Again, go to the tops of the shoulders and inhale. If there's a particular spot in the tops of your shoulders, focus on that. If not, just the whole area that's the top of your shoulders. And then just be still. Begin inhaling. Your awareness is on the front of your throat, the whole front of your throat area. Just pause and be still. To the sides of your neck, each side. Do the sides of your neck. You're doing long, slow, deep breaths with your awareness on the sides. Just give yourself a break, pause and let go for a moment. Just be still. Begin inhaling on the back of your neck. And then give it a break. Pause and let go. Explore the base of your skull, all along the base of your skull. Long, slow, deep breaths. And then just pause and be still. Notice how your body feels, your neck, also your mind. Notice how your mind feels, the activity, the thoughts. We're going to do just a little tiny bit more, but let's give you a break. So how about we come straight up on the hour at noon Pacific, and we'll just do a little tiny bit after that before we break for lunch, but I'll see you in 15. Everybody, let's come on back. And so a few people here that are on site said that like in that process, not only do they feel more relaxed and better, but they were getting visuals like flashing through their mind. You know, either from the past or just like information coming in. And so that stuff comes in when you go into a deeper level of parasympathetic activity. So we're going to go and now treat the energy centers themselves. The throat chakra is the main chakra for the throat muscles, but also lymphatic function. And then the throat minor is an extension of the throat. The jaw minors are extensions and directly tied to the throat. And then the back throat is just the backside of the throat. So we're working the throat in a lot of different ways to the throat itself and then the things that support throat function energetically. And so again, you're still using the same oil you've been using, right? Same oil. So whatever it was, the Sage Supreme, Violet Healer, any of the sages, lavenders, the spruces, Sitka, whatever you've been using, just continue. And now begin inhaling. Your awareness is on the throat chakra, so the upper part of the throat. You're just taking long, slow, deep breaths. Your awareness is still on the throat. You're taking nice, long, slow, deep breaths. And then just pause and be still. Begin inhaling. Now you're on the throat minor, which is down at the bottom of the throat, that little notch between your two collarbones. The bottom of your throat, the throat minor. Long, slow, deep breaths. Then just let that go. Just be still, let that go. Your awareness is on the jaws where they hinge, like right here, right in front of the ear canal. Awareness is on the jaw minors, where the jaw hinges in front of the ear canal. And then pause. And then the back throat, the middle of the back of your neck. And then just be still. Notice how you're feeling. Notice your body. Also move your neck around. How's your neck feeling? We're prepping for the deep dive into the sternocleidomastoid after lunch. So let's do one more cycle. So you're again inhaling. Your awareness is on your throat. Nice, long, slow, deep breaths. If you want, you can take a little bit of the oil and dab it on the centers. You can dab a little bit on your throat, the throat minor, dab it on the jaws, and then around on the back throat. So you're inhaling, your awareness is on your throat. You're taking nice, long, slow, deep breaths. And then let go. Just let go. Begin inhaling on the throat minor. Nice, long, slow, deep breaths. And then pause. Up to the jaws. Long, slow, deep breaths with your awareness on the jaws. And then pause. And then the back throat, the middle of the back of your neck. And then just pause and be still. Notice how you feel your body, your neck, your mind. And let's go ahead and share experiences or ask questions about the 3 processes we just did. You can unmute yourself or type in, but go ahead and fire away.
Amazing. Earlier, I'm trying to find, someone said I have chronic neck pain and it's substantially better.
Mhm.
And that was, I think, even in the first, like the next segment we did.
Mhm.
After chatting. Go ahead, Linda.
Hey, Linda.
Hey, so I can't remember at what point in the process this happened, but in the beginning of the process, we were clearing some things or around the neck, and you asked us to focus in on a particular area. Oh, we were looking at the neck, and is there a specific area that was bothering you? You know, and then you were like, just be with it so that it will like get rid of your resistance. Well, what was interesting to me was that I was noticing sensation that was uncomfortable and painful in my teeth on the right-hand side here, like on this side and this side in the teeth, and then like up into what I would consider to be the nasal cavity. And I was just wondering, is there what is there a connection between that part of this and what's happening here?
Like, was it upper or lower? Because I don't get to see a picture of you guys, so.
Go ahead and show again where you're feeling it and I'll do a demonstration with
Oh, it was, so the right-hand side, the upper part of the teeth on that side of
Okay,
the
up in
face,
that area.
lower, and then up into that
So,
cavity. Yeah.
so like when it's lower, it can be the sternocleidomastoid or sometimes something else. But when it's up in the upper teeth and even in the sinuses, that's a lot of times coming from that temple area. And so as you kind of go through and unwind it, this is one of the things with trigger points or with like pain syndromes is it's not just always like clear, like this is where you feel pain. There's the primary pain, and then there's a secondary pain and a third pain and a fourth pain. And so what happens sometimes, and the same with trigger points, as you start unwinding some of them, all of a sudden they were always there, but they were being overridden by the primary pain pattern or the primary trigger point in this case. And so as you unwind them, it's not like they started hurting. They were always hurting. It just wasn't registering. And so I would go back to the beginning with the spikenard in the temples, like with the liniment and things in the temples, because one of the things that happens is like from this area of your temple is the pain will radiate down into your teeth. And so when you have that issue, it can be sinus related. The sternocleidomastoid will also radiate pain up in, like what most people call sinus pain is actually sternocleidomastoid pain.
Wow.
Like it's I mean, the sinuses can have pain, but like 90% of it is probably more your neck than your actual sinuses. And usually the neck is agitated because of the sinuses, so they go hand in hand. But if you're trying to reduce the pain, it's actually more the neck. In your case with the teeth, it's more your temple.
Okay. Great.
Yeah.
Thank you. Thank
So
you.
if you just keep working that, it should go away. The spikenard will work, and sometimes if you really want to deactivate the trigger points, you can use the trigger point blend, or you can use terebinth. Terebinth is really good for that as well. which
Okay,
is just pine wood oil. Like it's pine oil, but from the wood.
great. Thank
Yeah.
you.
You're so welcome.
And go ahead, Lucinda.
Hey, Cindy.
Hey, how are you?
How are you?
This this was really relaxing, and I have a lot of neck issues from having it fused, and
Uh-huh.
I of course I fell asleep with my head like all the way back, and it seems to have like triggered this feeling of like there's for lack of a better way to explain it, like a ball in my throat, and it's sort of like a choking sensation.
Yeah.
And it's aggravated like a laryngitis.
Try inhaling the lantana. Do you have lantana?
I am sure I do someplace. That's not what I was
Yeah.
using,
Yeah. Try
but that's the
because
best way.
yeah, like because part of what happens is like when you fell asleep with your head back, you stretch the sternocleidomastoid, and part of
Right.
what it is like it can make you feel like a ball in your throat, or like you know how sometimes your throat doesn't feel sore until you swallow, and like you swallow and you go, oh, my throat's a little sore. That's actually still this neck muscle that we're treating.
Yeah.
And so it's just probably that, like it aggravated that. So the lantana will work. If you don't have that, just even take the spikenard and rub it on those rope muscles and just keep stroking it down like this, and it will
Okay.
relax those muscles. Yeah.
Okay.
And if it doesn't, let me know. Yeah. But
All right.
but that's what should happen. Yeah.
Thank you so much.
You're so welcome.
And go ahead, Barbara.
Hey, Miss Barbara.
Hey there. Hello, everyone. I feel like one of those curmudgeonly folks of the generation before me, in that my neck felt absolutely fine when we started, and I have felt less and less fine as the morning, as the
Really?
gone on. Yeah. So is it just because my Mingmen is overactivated, or is there anything else going on?
I'm not sure. Let me look at you for a second. I think it might stabilize with the stuff that we're going to do after lunch.
Okay.
Like, I'm sorry to say, but like, you know how I just said for Lucinda to do the lantana, you could probably inhale the lantana with your awareness on the throat minor, and it will probably stabilize the neck for you a bit.
Okay. Thank you.
Do you have a bit of a neck issue, or?
I haven't in a while. Occasionally I do, and I associate it with sleeping, but eons ago, I had 2 car accidents 3 months apart.
It's a sternocleidomastoid issue. The lantana should help quite a bit.
Okay.
Like, you know, we're going to go back and forth with lantana and anise, or, you know, there's other choices, but I think you have both. Like, I would just, even if you just go back and forth with them and not even specific on the throat, it will probably relieve it.
Okay.
Yeah.
So did something else calm down that made me aware of this issue, or I guess I'm struggling to understand
I'm
it.
not
and I
sure,
don't
but
think
it does sound like a bit of sternocleidomastoid issue. And so, you know, sometimes in the unwinding, like, you know, problems that it's not that they're laying dormant, they're just being managed, and now they're not being as managed as well. But it was like a problem, but it was not in your awareness. And so sometimes they become, I mean, you become more aware of it. So I think that's all that's happening. But let's get you stabilized. Like, so lantana and anise, or at least just the lantana.
Okay, thank you.
Yeah, you're so welcome. If you don't have those, grab some hyssop.
I think I have both of those.
Okay.
I've also been aware of some sadness at a very minimally conscious level. I don't know if that's connected to any of this.
It like when we go through and unwind things, like sometimes stuff kind of pours out. It should pass. Like whatever
Okay.
feelings kind of pass. Like there is this thing in
I mean, they aren't unsettling. I'm just aware of them.
Yeah, it's God, in Chinese medicine, it's called like it's like plum energy or plum bob energy or something like that. And it's tied to grief. And it's like it's a you know how like when you're sad or something, you get that little like catch in your throat.
Mhm.
You know, like when you've been crying or after you've been crying or you're just really sad and you get that little like sometimes that can get like kind of stuck in there. And as you unwind it, like that old grief, whatever it was, just starts emptying out.
Okay.
Yeah,
Thank you.
it has a name. Like it's like I think it's called plum chi actually. Plum chi. I could be wrong. It's been so long that meridian therapies aren't my specialty. So like I can never remember that stuff because I don't work with them all the time. I mean, I'm aware of them, but I think it's plum chi energy or plum chi. Yeah. Chi means energy, so it's like saying plum energy. It's plum chi. Yeah.
Anybody here want to share anything? Have any questions? I have some in chat, but I just want to share with you guys.
Everybody's good.
Okay. Feeling more patient with and accepting of self.
Oh,
Less
very
need
nice.
to be-
Yeah, yeah. That's always good.
I have had significant facial asymmetry, but with what we've done today, I now notice better symmetry in the TMJ. And the
Yeah.
stress I felt earlier between my eyes has disappeared. I did have images of past trauma experiences prior to my own existence when we first began the focus on the throat.
Mm. Yeah, like sometimes, like you said, like the face looks one from one side to the other. A lot of times, if you unwind the jaw, it will actually balance out quite substantially.
I have had a tooth that's been hurting a lot the last couple of days, and it was really intense last night and this morning. But what we've done so far helps somehow. Feels maybe 30 to 40% less intense.
Is it on the upper or lower?
Oh, sorry, upper left.
Yeah. So work the left temple a lot more. Like put the spikenard or the, you know, whatever you are using, really rub it into the temple. Like about like this high, like across this area, about like that. Like so above the ear, just all the way across. And you know, kind of get in where you're just like really not like scratching it, but like you're really just kind of moving the tissue around. It should help that quite a bit.
They said, I'm hoping what we do the rest of the day will help even more me.
Yeah, yeah.
Feeling relaxed and less brain fog now after using Spanish sage. Thank you.
Nice.
Can we use one oil from the list on the feet and use a different oil in the other steps?
Yeah, yeah, sure.
Feeling so much better. I've been zonked.
Yeah.
Would a body tonic or Theralotion work for the foot application
Yeah.
to be more cost effective?
Yeah, yeah.
I started experiencing indigestion during this session. Is that a secondary pain from the neck work?
Indigestion or burn. Looks like the solar plexus is letting go of something. You have like chakra root cleanser or Palo Santo. your awareness on the front back solar plexus. If you don't have those, then use whatever you use these last few applications, you know, the sage or the lavender or whatever it is. And front solar plexus, back solar plexus, just keep inhaling it for whatever reason. Yeah. Sometimes stuff just comes out. Like, yeah, it could be old stress, it could be old, who knows.
They said, okay, thank you.
Yeah.
I actually have an amazing amount of energy. Must have been a nap. My sinuses are very clear now. I still feel like there's a thumb in my throat, minor. Any other suggestions, or keep calm and carry on with the sage?
The thing that we do after lunch, again, lavender is especially good for this, but whatever is in the segments for that, you can begin inhaling, but we will be addressing that kind of stuff after lunch.
Neck is looser and also spine. However, the lower rib cage is achy.
Yeah, maybe just put something for pain on that spot. You know, I know you have an injury there, so a little mint or a little, like, even the helichrysum or something. Yeah.
Very relaxed, like a rain pedal. That's good for that side.
Okay, so we're gonna break for lunch and 1:40. We'll come back at 10 after 2. So that's an hour and a half. We'll come back in an hour and a half. And we'll hit the ground running and do segment 2. So.
Can I take helichrysum internally?
Yes. Hey, everybody. Let's come on back. And let's jump to segment 2. I hope segment 1 did you well. And now we're going to be a little bit more specific. So going back to what we did at the beginning with the spikenard, or if you have a spikenard tonic, or you've added spikenard to some alcohol or witch hazel or something of that nature, you're going to take it, and instead of doing it on the sides of your head, which you're still more than welcome to do, now you're going to do it on the sides of each neck. Like you're kind of going down the sides and even down the front a little bit, but just cover the neck. If you're just using essential oil, put several drops in there, kind of rub it together, and then just rub it in the sides of your neck. So you're using the body tonic or essential oil neat, and you're rubbing it on the sides of the neck. We're going to be very neck specific now, and we want to deepen the potential release for the neck. Just that feels good, doesn't it?
I knew I was already gonna take a nap, but
Right. Now we're going to do a thing. First, we're just applying that just to prep the neck. And just to give you like a little bit of background, right? Just a little bit of background. When we think of like muscle tension or like, oh, I got a cramp in my neck or on my back or in my foot or in my calf, there's different kinds of cramps actually. Not all cramps are the same. So a cramp that we get, like, you know, a Charlie horse, like, you know, you're in the middle of the night and you get the cramp in your foot or in your calf, that has some neurological reason, and usually there's lack of blood, and there can be a deficiency of minerals that causes the muscle to cramp up, right? And then there's variations of that. But then there's a thing called a contracture. And a contracture is that there is no neurological reason or circulatory reason for that that tension in that area to be present, right? So it's not because of the physiology, it's not because lack of blood flow, it's not because there's not enough magnesium or calcium or potassium in the blood. It's just there's a tension in the area that is what you would call just non-specific. It's just there's tension there. So trying to treat it with things that are antispasmodic or like magnesium or something, they're not very effective because we're not really addressing what the issue is. Contractures are usually related to misalignments in the body. You know, if you walked around with your shoulder up like this, your body compensates. Then over a period of time, there starts to be tension in certain areas because of the misalignment, right? It's not because of the nerves. It's not because of poor blood supply. It's not because of any of these things. It's a misalignment of something in your body. So if your hips are off, even though it's your hips, your neck still has to be the thing that adjusts. And, you know, your head's always trying to keep your eyes horizontal, right? So if your shoulder goes up, you don't walk around like this the whole time. You go, okay, gotta compensate to go like this, right? So this side contracts, this side becomes elongated, right? So in the acute phase, the shortened side is what hurts. But if you think about the areas that hurt the most, they're usually in the elongated side. That's when it's become chronic. The difference between acute and chronic here is 30 days. Under 30 days, it's acute. After 30 days, it becomes chronic. Now, when there is like something like this, at first it's going to hurt where the contracture is, right? Or where the muscle has shortened. But later, what happens is it starts to hurt in the area that's elongated. That means it's also chronic. So here, we're not just putting the oil on one side, like, hey, it hurts over here, let's put it over here. We're putting it on both, right? So the issue with a contracture is if you can take the tension out, you actually begin to unwind muscle imbalances. Right? So what are oils that are super good for muscle imbalances? Ironically, it's spikenard and or valerian, right? So when you mix those or use them by themselves, it helps take the tension out, but it also helps to even out the imbalance to correct the postural misalignments, right? So if you have something where something's shortened and something's elongated, as much as you treat it, it might reduce the symptom, but it stays there. But if you keep putting spikenard and valerian on it, what happens is it starts to go like this over a period of time, right? So remember what we did before lunch, where we did the thing where you checked your jaw, you raised your shoulder, and then your jaw changed, right? So that would be a postural misalignment. Your jaws and your neck are highly adaptive to the things going on below it, right? So even if you correct some of the things below, like say your hips elevated, you correct it, your neck is already like, yeah, but I'm already doing this thing. Like, let's just keep it the way it is. Let's just, status quo is really good, right? It's how homeostasis works, right? So by unwinding the neck, it allows you to unwind the things in the body and to have it hold. Right? Later, when we go deeper into the sternocleidomastoid, in really severe cases, sometimes it's hard to correct postural misalignments because the muscles around your eyes go into spasm and they only look a particular way because they've had to compensate for so long that you put it back in place and the muscles go, no, we're supposed to go like this. This is how we work because your eyes are critical, right? So again, the sternocleidomastoid is what causes the spasms in the muscles around your eyes. So if we unwind the neck, we unwind the eyes. If you unwind the eyes, it becomes easier to put yourself in alignment, right? And so this seems like very simple, but it's like it pulls together a lot of different pieces so that when you make shifts in your body, it stays, right? So we've put the spikenard on the side. It feels good. It feels soothing, but just know it's taking tension out of your neck and it's balancing out any sort of muscle imbalance that is in your neck. So consistent application balances out those muscle imbalances. Your neck is highly susceptible to muscle imbalances, highly, highly susceptible. You could say whiplash syndrome, like if you gave it a different verbiage, it's muscle imbalance syndrome. It's exactly what it is. It's just the muscles in your neck got put out of balance and just kept going down the rabbit hole, right? So it doesn't matter if it's a month old, a year old, 30 years old, you can unwind that whiplash. And even if you go, well, I didn't feel any issues like when it happened, but a couple of years later, my neck started bothering me. It's because the muscle imbalances happened, and then it just kept spreading and kept spreading and kept spreading and kept spreading. So regardless of why your neck's in the place that it is, let's just unwind it. It doesn't matter why, it doesn't matter the story, it doesn't matter the when. It's if your neck is a little jacked up, let's unjack it. Let's just if your neck feels better, a lot of times you feel better overall, right? You feel a little better, you feel a little nicer, you feel like you can take a punch. If you think about when, say, you walk into your boss and your boss gives you a what for, like you didn't do this, you didn't do that, does all that. Energetically, the words are coming at you, but energetically, there's energy being projected at you, right? Some of it hits you in the basic chakra, right? Some of it hits you in the gut. The other place that it hits is in the throat. The throat and the gut are the two most susceptible areas for anything. If somebody walked up and was trying to punch you, if they punched you in the throat or in the gut, it would be debilitating. Same thing works when somebody's projecting negativity at you. They go for the weak spots. The weak spots are the gut and the throat. These areas tighten up to prevent that energy from coming in. Then when it's gone, the throat and the abdomen go, yeah, but they might come back. There might be another one. Like we're susceptible. So these areas start tightening up. So it produces eventually digestive issues, and eventually it causes respiratory issues, right? If you look at, like when I was running that study for UC San Francisco back in, I don't know, a long time ago. It was back before seatbelts were like so pushed. That's how old it was. Seatbelts were just becoming a thing. How they push us to do seatbelts. Like it wasn't that long ago where you didn't really get pushed to wear seatbelts. And when somebody had a whiplash syndrome, the issue was eventually caused a respiratory issue, and then eventually it caused a digestive issue, and then the blood pressure would go up. Usually not right off the bat, but we can mark it and almost tell like how far out it was from the injury, because we were dealing from happened yesterday to happened 10 years ago, right? And the issue is that even like a car accident to the body feels like an attack, right? You're in a bad weather where you're in a hurricane, the body sees that as an attack. You're in a bad rainstorm and you can't see, the body sees that as an attack. So the thing that happens is the throat tightens and the gut tightens. So when the gut tightens, when the smooth muscle of the gut or the smooth muscle in the respiratory tract tightens, the byproduct is anxiety. Bottom line. So unwinding the gut, unwinding the throat are very good ways to reduce your anxiety and body tension. A lot of anxiety is actually physiological. There's some that is psychological too. We'll talk about that tomorrow, right? But physiologically, it still causes the anxiety that we're going to talk about tomorrow in the Astara lesson, right? So you've applied the spikenard. Now, you can pull out your helichrysum, Palo Santo fruit. If you don't have that, you could use Palo Santo. The fruit works better for this, but Keep chamomile, poplar balsam, Siberian fir, good old fashioned wintergreen. Who doesn't love a little wintergreen? And terebinth, or the blend fascial release. In the kit, you got given helichrysum, so use the helichrysum. So basically, we're unwinding the fascia or the connective tissue. Remember, fascia is not the muscle, it's the tissue that wraps around the muscle, wraps around groups of fibers in the muscle, and then each individual muscle fiber is surrounded by fascia. So it turns into tendons. So you're going to begin inhaling, and instead of going, let's set the template for your neck, everybody's neck's a little different. So what I'd like you to do is explore your neck. Do I feel it in the front? Do I feel it in the sides? Very common place to feel it is on the back, like the back of your neck. For those of you that feel something on the back of your neck, explore your neck for a little bit, and then I'm going to give you a potential little thing that might help that, like a little trick. You're inhaling, and just wherever you feel something in your neck, you know, when you walk, like say, okay, watch me for a second. Like I go, okay, my neck feels fine, but if I put my neck forward, I feel it in the spine. Move your head forward and inhale in the area where you feel a little something. Or if you go, I feel fine this way, but I can only move my head this far on the other way. Like wherever you feel that in the neck and shoulder, inhale. Like wherever you feel the blockage, the tension, the area that feels wound up, wherever that is. Okay, be still. Okay. Now, granted, sometimes when you have issues in the neck, especially the front of the neck, you're not always going to feel it in the neck. You're going to feel it other places. A lot of times where you feel it is in the back of the neck. So like, watch me for a second. So if I put my head down like this, I might feel it in the back of my neck, but I might feel it in the spine where it's starting to be the low neck or even the area between the shoulder blades, right? So let's just do this for a second. Check to see how your neck feels when you put it down and start just arching forward a little bit. Do you feel tension or pain or a little agitation in the spine? Almost everybody does. I mean, it's rare. And if you don't feel it, give it time. It will catch you at some point. You know, it's just part of being human, right? Okay, so here's the trick. Here's the trick. We're going to do it, and then we're going to talk about it, and then we'll do it some more, okay? So whatever oil you're using, inhale it, but inhale with your awareness on the ear canals, the holes in your ears. You're not moving your head around. You're just taking some long, slow, deep breaths. Okay, so now put your head forward again. Kind of changed a little bit, huh? Your ears are making your neck. No, I'm kidding. uh, I had a whole little joke I was going to do in my head, but it's funnier in my head. So basically, this is what's happening: is there's this little joint in your head where, like, what your brain sits on, and then the back of your head, like here's your brain, here's the back of your head. There's this little joint that kind of goes like this, like, it kind of just moves like this, right? And so what happens is sometimes that joint gets locked, and sometimes, just like a bone comes out of place in your neck, sometimes that little bone just minutely like slides to one side, or worse yet, it like rocks where it's high on one side, low on the other side. So this is tied to how the cerebral spinal fluid kind of pumps through your head. This is what makes this little joint go like this, right? So when it's locked up, right? When it's locked up, guess what happens? The back of your neck aches, and then it starts to hurt down your cervical vertebrae, especially from about C4 down, like C3, C4 down to about like T4, maybe T3, T4, which is that area right between your shoulder blades, right? And when it aches in the neck, it's not a deep ache, it's a real superficial ache. Like you feel like, I feel like I could just like rub it out or something, right? It's actually this joint is locked. So there's these different techniques about how to unwind this, but energetically, how you unwind it is you go through the ears. So you're inhaling the oil with your awareness on the ears, and what you're doing is you're just unlocking that joint a little bit. You're removing the tension in that joint so that it can start moving again, right? So this is tied to like migraines, this is tied to neck pain, this is tied to various forms of headaches. In severe cases, it can be one of the causes for seizures. Okay, so begin inhaling on the ears again. And then pause and be still. Now pay attention to your neck. Explore your neck. Where are you feeling it in your neck? The front, the sides, the back, deep, superficial. Where do you feel it in your neck? Wherever it is, your awareness is on that spot, and begin inhaling. Okay. I can tell because there's. I call that stage 3. Stage 4 is when you try to communicate with your eyes. Okay, and then pause. Okay, again, explore your neck. Like, where do you feel it? And when you're exploring your neck, like if you go, well, I feel it like down by the shoulder blade, go down by the shoulder blade. I feel it up here in the chest, or sometimes you'll feel it in the sternum, wherever you feel it. Just as you move your neck around, just unwind it. Notice how you feel like when you unwind your neck a little bit, don't you feel like a little bit more chill? Like a little bit more like easygoing, or like I'm not as uptight as I was this morning. And you weren't uptight this morning. A lot of times, a lot of what we feel emotionally or our thoughts is more physiology than we give it credit for. According to Holy Master Joel Kuhl, who gave teachings to Alice Bailey, he said the physical body is so dense, it's so hard for the emotions and the mind to overcome it until a certain level of development, which means that for a long time, like if you want to shift things in your emotions in your mind, you go to the body first, like unwind the body, and then the emotions of mind kind of follow. Okay, so let's do this. Notice how your neck feels right now. So you're not inhaling, but when you move your head back like this, where do you feel it? Do you feel it in here? Do you feel it along the sides? Do you feel it on the back? Wherever you feel it, just you don't force the direction, but wherever you feel it, put your head there and then just inhale. We're doing a quick version of fascial release. Okay, then stop. And then when you lower your head down, where do you feel it? In the spine, in the neck, up in the head. Sometimes you might even feel it in the jaws. Wherever you feel it, inhale the oil into that area. Okay, and then bring your head back up and just let it be in the normal position. How is it feeling? Okay, so now you're going to turn your head to one side, let's say to the right side. Where do you feel it? Do you feel it on the same side? Do Do you feel it on the other side? Do you feel it in the shoulder? Do you feel it down by your shoulder blades? Wherever you feel it, inhale wherever you feel the tension or a little bit of pain. The pain is usually achy unless you have a problem, then it can become sharp. And then just let go for a moment. Now turn your head to the other direction. When you turn your head to the other direction, where do you feel it? It's not always going to be in the same spot. Feel your spot and inhale. Okay, and then just let it normalize. How's your neck feeling right now? If you feel you need a little touch up in one of those spots, go ahead and take a moment. Otherwise, just put your awareness on your neck and take some long, slow, deep breaths. You be the judge. And then just be still. Begin inhaling. Your awareness is on the bottom of the tailbone, the basic chakra. You're taking nice, long, slow, deep breaths. Move your awareness to the front solar plexus, that area below your ribs on the upper abdomen. The back solar plexus, the mid back area, the area below the shoulder blades. And then just be still for a moment, just let it incubate. Your awareness is between your eyebrows. You're taking nice, long, slow, deep breaths. Awareness is between the eyebrows. You're taking nice, long, slow, deep breaths. And then the top of your head, the crown, the top of your head. Hey, just let go for a moment. Notice how deeply relaxing that is. Does that be super relaxing, right? It's not like it's relaxing, like, oh, it's calm. It's almost like, right? So if you notice, we like explored the neck, and then we did the basic, the front solar plexus, the back solar plexus, the ajna, the crown. What do those all have in common? Different aspects of the will. Body tension directly corresponds to the will. You know, even if you talk about like, okay, my shoulder's elevated and then I have to correct, what is that tied to? The will to survive. Like you're normalizing your eyes so that you can thrive in the environment. So you're not just wrestling with the body, you're wrestling sometimes with the will. And the will is cagey, you know. But like when you start doing it through soothing different things that it's associated with, all of a sudden the will is like, it's all good. Like, go ahead, make whatever changes you want. But when it's agitated and you start to make changes, the will is like, no. Like, haven't you ever had like a family member or a boss where you come up with a good idea and then they go, no. And then 2 days later, they have this brilliant new idea that it just happens to be your idea. It's part of the will, like they're pushing back no matter what, right? So when you go through and you unwind the neck, when you follow it by going through and just soothing those four centers, the solar plexus, the basic, the ajna, the crown, all of a sudden the body is like, I can put my guard down. I can rest. Like I can let the body realign. Like you're not in such survival mode, right? So we're not just looking at the neck component, we're looking at what causes the neck to do what it's got to do. Like it's causing it to tense up, it's causing it to whatever. And you keep doing this. Part of it is you're not choosing to do it. You're dealing with mechanisms that are about you trying to survive in the world. So it's conditioning. Like, you had a near car accident, your boss yelled at you, you went through a breakup. Everybody at Thanksgiving is weird, especially Uncle Bob. Whatever it is, you can make your list, but every little bit makes the bill go, we need to step our game up a little bit. We need to step it up a little more. We need to step a little more. And pretty soon you're like just sitting ready to take charge, to run, to fight, whatever it is. So it's not just, oh, I got to calm down the adrenals. I got to calm down fight, flight. I need to balance out the nervous system. Yes, to all of those. But who's calling the shots? The will. So by going through and soothing these things, if you try going at the will directly, it pushes back. So you almost got to backdoor the will. Like, okay, we're going to do some soothing things. Don't make eye contact. Like, just, you're calming down. Oh. You just, like you're trying to get a squirrel to eat a nut from your hand. Like, you just look away and act like you're not interested, and then you go for it, right? Same idea. So the more you cycle through this, you'll notice, and you'll just notice like weird anxieties that I don't have anymore. They're just floating away. One thing that's very overstimulating to the will, being overstimulated all the time, be it social media, be it whatever, being constantly bombarded, the will goes, I gotta put my guard up. I gotta put my guard up. And then the behavior, the thoughts, the emotions, everything just starts to fall into place because the will's already made the decision, right? So by going through and unwinding this part with the neck and then unwinding the parts with the will, you're just soothing the will more than anything. And the will's like, okay, yeah, we could do that new thing. Yeah, let's try it. Yeah. Very interesting. When you treat this, you can almost feel when the wheel starts to kick up and get a little sassy. Like, okay, time to calm it down again. Because it's never just completely like, oh, I've arrived. It's constantly going to get agitated even again at some point, right? So let's go through and do the next piece and then come back to it, right? So set that bottle down and you're going to pick up anise, which is in the kit, basil, cypress, lavender, lemongrass, marjoram, pepper, or petitgrain. Any of those will work. So one of the big areas where you're going to feel body tension is the back solar plexus. So right off the bat, whatever oil you're using, begin inhaling it with your awareness on the back solar. Nice, long, slow, deep breaths. Awareness is on the back shoulder. You're taking nice, long, slow, deep breaths. And now just move gently into the spine. Feel the spine. If you have a spot that's jumping out at you, like when you evaluate your spine, you're like, my spine is okay, except for that one spot in my mid back or my low back. Focus on that area. If your whole spine is good, then explore the whole spine. And then just be still for a moment. And then again, explore the whole neck area. Go back to the greatest hits with the things you felt in the neck. Whatever issue jumps out at you, jump on it with this different oil. And then just be still. How's that feeling? So let's go back to the segment before. So you were using chamomile or helichrysum, Palo Santo fruit, poplar, Siberian fir, terrapin, wintergreen, or fascial release, whatever it was. Pull it out and just explore the neck, the greatest hits. Whatever issue you felt in your neck, your awareness is on that spot. Move your awareness to the basic, the bottom of the tailbone. Long, slow, deep breath. Your front solar plexus, the area below your ribs. Nice, long, slow, deep breaths. And the back solar plexus. Go up to the area between your eyebrows. And the top of your head, the crown. Just pause and be still. You notice the tension in your body's a little different. Pull out either the anise, the basil, the cypress, lavender, lemongrass, marjoram, any of the peppers, marjoram. So in the kit, you guys have anise. Begin inhaling. Your awareness is on the back solar plexus, the mid back. Move your awareness to the spine. And then just pause for a moment. And as you're pausing, check out your neck. Where do you feel it in your neck? Wherever that is, explore your neck. Begin inhaling. And then pause and let go. We're going to drift off into a 15-minute break. So take a nap, stretch your legs, get a snack, whatever you want to do. We'll come back at 25 after, and we're going to start doing a deep dive specifically on the sternocleidomastoid. Everybody, let's come on back, and we are at the top of page 4, and let's post that picture of the.
Okay.
So we're going to talk about the sternocleidomastoid, and to keep from having to say that long word over and over again, we're going to call it the SCM. SCM. So basically it comes from the backside of your ear, the base of the skull, it comes down, attaches to the collarbone and to your sternum. So have we posted that?
Yeah, we're posting.
So there's a picture that's posted there for you. The reason it's not in your booklet is it's copyrighted, and so can't put it in the booklet, but we can show it to you. And I guess we can modify it and put it in there, but I don't know. So we think of muscles as just like, oh, it cramps or it hurts. But when muscles develop what you call activated trigger points, which is when lymphatically they're so backed up and they become so toxic that they start to cause neurological disturbances. So let's just go down this list and see if this resonates with anything that you got going on. So abnormal gait, ability to walk a straight line. So remember, like if this is your feet and you're walking, when you have a sternocleidomastoid issue, you'll go like this. You know, every once in a while you have to throw a leg out to, you see this very commonly with whiplash patients, or they walk a straight line like this, right? They're not drunk, they're just, their gait's off. Like it's hard for them to walk normal in a straight line. It's basically an injury to the neck. Aerophagy is gulping of air. Like you see this a lot when they're eating food, but like they'll be talking and then they'll go a little bit past their normal breath and then they'll go, right? Autonomic disturbances, which is the imbalances in fight, flight, and rest and repair. So another way of saying that is disturbances in the sternocleidomastoid produce anxiety, and in severe cases cause panic attacks. Back of head pain, you see the image that we're posting. Those red areas are referred pain patterns. Like, so you see there's like pain in the ear, the pain around the eye. A lot of times what we call sinus pain is actually pain being referred by the sternocleidomastoid. Remember, like if you have a stuffy nose, you're having to breathe harder to elevate the rib cage, and part of how that happens is through the sternocleidomastoid. So in a way, yes, it's sinus pain, but treating the sinuses doesn't alleviate it. It's actually, you have to treat the neck. Cheek pain, conjunctivitis, spasmodic cough, which happens a lot of times after colds and flus. Sometimes people will say it's a smoker's cough, but it's basically a spasm in the sternocleidomastoid. Dizziness when turning the head, like going like this, is a way to, like, if you get dizzy doing this, you have a sternocleidomastoid problem. It's compressing the carotid sinus, right? So you basically are cutting off blood flow to the head. Blurry vision. You know, you think, oh, my eyes are going. Is it your eyes? Sometimes it's just your neck is a little tight. And if you've ever been reading and like the print kind of jumps a little bit, it's actually your neck, it's not your eyes. Droopy eyes, or even if it's just one eye, dry cough, pain in the ear, like going into the ear canal, tinnitus, which is ringing in the ear, or sometimes deep in the ear, you're like in your ear canal, your ear will itch. Secretion of tears, like excessive, like if your eyes water a lot. You feel like you're still moving, like say you're in a car, you're moving and then you stop and it still feels like you're moving. That's actually still sternocleidomastoid. If you've ever gone around a corner and like you feel like you're tilting, or again, it's a disturbance in the inner ear. Like when the sternocleidomastoid's off, it causes disturbances in your balance and inner ear. Front of chest pain. Frontal headaches, which means like up in that area. Headaches and migraines, pain in the cheek, tip of the chin. Pain in the throat, like it's deep, like on swallowing. Like you sit here and you go, okay, don't really feel pain, and then you go, that hurt, right? You think, oh, I must have a sore throat. You have a sore throat muscle. Like it's the muscle that's doing it. It's not the throat itself. Yeah, postnasal drip. You know, you think you have sinus issues, which it's manifesting in the sinuses, but it's actually the neck muscles. Runny nose, rhinitis, which is inflammation in the sinuses, sore throat. Now, you know, sometimes a sore throat is a sore throat. Sometimes it is actually, again, the sternocleidomastoid. So osteopathically, like if somebody says they have a sore throat, first thing you do is you get in and you manipulate the sternocleidomastoid. And then you go, is the throat still sore? Because it's almost instantaneous, it'll go away. You have to say, yeah, then you go, it's probably an infection. Then we got to treat the infection. But at first you treat it like a soft tissue issue. Now, here's a big one, is it causes spasms in the muscles around your eyeballs. So it can actually contribute to your eyes going a little south. You know, I went a very long time without wearing glasses, and then all of a sudden, not only did I need to have a prescription, but it was a big jump. Like I needed a really super strong prescription. You know, the doctor was like, ugh, and even the people at the eyeglass place, I was like, wow, this is pretty strong for your first one. So, you know, I got it. And after about 3 or 4 months, I couldn't wear those glasses anymore because it was more blurry with them than without them. And so what I was doing, I was taking things for my eyes, you know, doing things for the eyes, but I was doing healings on my eyes and my throat. And when I went back to the doctor, he goes, you barely need glasses right now. He goes, you're right on the edge. Like he goes, you could probably get away with readers. But I don't know, I got so used to wearing glasses that I feel a little bit better with them than without them. But like, there's times where I need to take them off because I can see better than I can with the glasses themselves. The issue was my neck. You know, I'd had a really bad neck injury when I was young. So from time to time, I got to go through and just unwind it. I got to clean it up. Swallowing mechanisms, reddening of the eyes, tearing, temporal headaches, you know, getting pains in the temple, TMJ issues, traveling sinus issues, which
I know, you're just like listing almost.
yeah.
like, all my
So
goals.
every time I come to California, Samantha's like, every time I come here, I get sinus issues. And it's like, is it really sinus issues in the air, or is it, you know, with all the travel and the change in barometers and all that, it can actually cause this issue. And then visual perception problems. So all of these things are potentials because of this muscle. And you see the pictures, it's these two rope-like muscles that come down from each side. So there's 2 oils that we're going to use. Lantana is one of the best oils for the deeper head of the sternocleidomastoid. I mean, honestly, other than that and like asthma, I don't know that I use Lantana for just about anything else. And then the one that gets the more superficial head is anise. Caraway and fennel work as well. But if you don't have lantana, hyssop is a good bee choice. But this is what we're going to do. You're going to pull out the first oil. Begin inhaling with the lantana or the hyssop. Nice thing about lantana too is it's also a cheap oil. It's not a crazy expensive, super fancy thing. It's very inexpensive. You can go crazy with it. You're inhaling and your awareness is on the throat minor, the bottom of your throat. And then explore your neck a little bit. Wherever you feel something, just explore the neck and inhale. And then pause and let go. Just pause and let go. Begin inhaling again. Your awareness is on the throat minor, the bottom of your throat. You're still on that throat minor. You're taking nice, long, slow, deep breaths. Yeah. Research aids. Hmm. Well, and just pause and be still. And then again, explore your neck. And wherever you find a spot, inhale it with the lantana or the hyssop, whatever you're using. Okay, and then pause and be still. Now, let's set that bottle down. We're going to come back to it, but let's set it down for right now. And let's go to the next oil, which is either anise, caraway, fennel, or aerophagy. Anise, caraway, fennel, or aerophagy. The throat minor is the little notch between the two collarbones, the bottom of the throat, like right here. See where my finger is at? Yeah. So again, your awareness is on the throat minor, the bottom of the throat, and you're taking long, slow, deep breaths. You're exploring the neck and just wherever you feel it. And then just pause and let go. Same oil. Your throat minor, the bottom of the throat. Explore the neck. And then just be still. Even just try swallowing. You notice something's changing in your swallowing. Go back to the lantana or the hyssop, whichever one you're using. And begin inhaling. Bottom of the throat, known as the throat minor. Then explore your neck. Then just let go. Let's go to the second oil, the anise, the caraway, the fennel, the aropachi. We're taking nice, long, slow, deep breaths. And then pause for a moment, explore your neck, and then inhale into that area. And just be still. Without feeling. Well, this next little piece is what I like to call the rapid fire rounds. In your right hand, the lantana or the hyssop, and the left hand, the anise or caraway, fennel, arophagy. The right lantana, left the other one. Yeah, pretty much. Okay, so you can put your awareness on the throat minor, or you can just inhale them, right? So just begin inhaling with your right hand.
Lantana though.
Lantana, yeah. I mean, it doesn't really matter,
Because
but okay. Yeah, you're just inhaling. Yeah. And then switch to the other one. We're doing the rapid fire round between the lantana and the anise. So you're like two-fisted. So yeah, there you go. Okay, now switch back to the other one. Switch to the other one. And then switch back to the other one. Okay, and then just be still. Notice your body, notice how you feel when you swallow, when you move your head around. So let's take another break. We'll come back, we'll talk about what we did, and we'll go from there. So again, we'll come back at 25 after. Everybody, let's come on back. And let's go ahead and share experiences from the things that we've been doing since lunch and ask questions. You can unmute yourself or type in. Go ahead and fire away.
Yeah, go ahead, Trace.
Hey,
Yes.
Greg. Hey, so I so I have a lot of the different symptoms of
Yes.
SCM issues. And as we're going through this process, I'm like feeling them all at one time or another. It's like it's going through, it's almost like it's like, okay, is that what you want? Right now it's my right temple. Like a really
Just keep pushing through and unwind it. Especially, I mean, you've had what is it, like 2 neck surgeries?
Yeah.
Like you'll just have to unwind it. Like still kind of play with the stuff on the back at the base of the skull and go back and treat the back of the neck. So for you, keep going back and forward, treat the back of the neck and then treat the sternocleidomastoid in the front. But just keep unwinding it.
So keep putting like the helichrysum on the back, or should I put the
Helichrysum, you could use the vetiver, you could use things that are antispasmodic. The reason the helichrysum works is that it also kind of helps to release the fascia. So you could also use terebinth, terebinth on the back of the neck,
okay?
the nuchal ligament, the base of the skull. But just keep unwinding it. Yeah.
Okay. Thank
Like
you.
like when you get to the other side, you're gonna feel so much better. Like so much better.
I trust you.
Well,
Right
I
now
was
it
telling
doesn't
them on the break, like I had a lot of the symptoms, especially that abnormal gait where you go like this.
Uh-huh.
And like when I would walk, I looked like I was a little bit drunk. And have a lot of the eye stuff. Like I had a lot of the symptoms. When I was young, I got into a really bad car accident, and I didn't really break anything, but I really injured my neck really bad. And just as time went by, I mean, I started manifesting a lot of these symptoms, and I did a lot of different things, but unwinding it at first doesn't feel like, I don't know about this. And you just keep doing it. And then pretty soon it's like, oh, this is feeling better. It's feeling even better. It's feeling, it just keeps getting like better and better. But like when something's really wound up, you kind of have to play with it and go back and forth with things for a little bit. Because just unwinding it in one spot is not enough. You have to keep unwinding some of the surrounding areas.
Okay. Thank you.
Even the thing that we did like more towards the beginning of the book with like the sage or the lavender, where you did the front, the sides, the back, even that, like that's what that's kind of designed for.
Okay. Okay.
And then rub a lot of spikenard on the neck as well.
I'll do that. Thank you.
Yeah.
And go ahead, Rob.
Hey, Mr. Up.
Hey, Greg. Okay, so I too have a lot of those issues. I guess starting out when grade school, falling off the monkey bars onto the concrete below didn't help. So unwinding it. Let's be real clear about what's going on. I start with spikenard, body tonic, and basically bathe in that every night.
Okay.
Okay. And then can I jump to segment 2, number 2 and
Yeah.
3, and just swap back between lantana and the anise?
Yeah.
Okay. That would be considered unwinding it. I'm trying to be real clear about
That's
the unwinding. 'Cause I'm
very
not,
specific. That's very specific to the sternocleidomastoid, and that is unwinding the sternocleidomastoid specifically. The things that we did before lunch is unwinding the neck in a more general way. So,
okay.
but when you have a lot of those symptoms, just jump right to segment 2 and just start doing segment 2.
Okay. How about the application of the sages to the feet, the energetic state?
I mean, all of that stuff helps, but
Okay.
like you know, because like you, I had a very severe neck injury, and you
Mhm.
know, and I'd had all different kinds of therapy, and it was better, but it's still like I didn't have a normal person's neck. You know
Right.
what I mean?
Yeah.
And you know, I would unwind it with hyssop and everything, but when I started unwinding it with lantana, it got a lot better. And then when I started doing it, the lantana and the anise together, it's like it was another level. And I mean, I was telling them on break, or I can't remember when, but like when I first discovered the lantana, I mean, I literally would like at the end of the day, where you know had dinner and it's time to just wind down and start getting ready to go to bed, or you know relax, I would sit and just smell lantana for like you know an hour. Like I'd inhale for a while and then take a break and then inhale until the point where I was like, okay, I'm ready to go to bed, and then the next night I'd do it again. And I noticed that just in like 3 or 4 days, a lot of those symptoms dissipated. The ones that took the longest to dissipate were the things with my eyes. Like that
Okay.
one was the hardest. You know, it's like I just always like, you know, all the things like the teariness, and like the eye will get droopy, and like I can't even remember if I put this in there, but sometimes the eyelids will get a little swollen. Um, the spasms in and around the eyeball, like I would get all of that.
Mhm.
And you know, I noticed that, and even like around the eye, it would get like really oily, like really super oily. When I started doing the lantana, even that stopped. Like it almost felt like I was rubbing oil on my eyes, and I wasn't. Like it was just they were just getting weirdly oily. And so I had done a thing where I treated it with sulfur. And I thought, oh, this will calm it down. And didn't really calm it down. But when I started using the lantana, it calmed it down substantially.
Okay.
Yeah. Yeah.
Okay.
So
Good.
with just the bit that I know about your neck injury and things. I mean, almost everybody, even if it's not like a fall, like you said, you fell from the monkey bars, or you were backpedaling and you fell and hit your head, or you know, somebody hit you with a ball in the head, you know, when you're a little kid.
No,
I
that
mean,
was
all
Claire's thing, was to get hit with a baseball bat. So
yeah, yes, exactly. You know, or like you know you get in the head with a ball, or you know whatever it
Mhm.
is. And one of the other ways to do this that's not like trauma related like this, laying on your stomach with your head turned really hard to one side,
Oh, sleeping
like
on your stomach with your head cranked over?
yeah, like that will also aggravate this.
Okay.
So I love to sleep on my stomach, so what I do is I prop up a pillow next to my head so that my head's not all the way cranked.
Mhm.
So like my head is almost like straight. You know,
Yep.
it's not quite in the mattress, but it's just slightly off so that I can breathe. And then when I fall asleep, I'm leaning against the pillow. And then if I move, I just grab it and move it to the other spot. And that reduces the neck as well. Yeah.
Okay.
Yeah.
All right. Good. Thank you
Yeah.
very much for clarifying
You're
that.
you're so welcome.
And go ahead, Sonia.
Hey, Miss Sonia.
You for the alternating lantana and anise, you said it was at the base of the skull,
No, throat minor.
throat minor. Okay,
Yeah.
thanks.
Base of the throat. Yeah. Robert, you had a question?
Yeah, Sharon a question both.
Mhm.
So during this, every time I went to sleep, I'd be taken back to some trauma in this lifetime of a car accident or a medical condition that was traumatic. So I know there's trauma to work out of this. And I thought that was interesting to go back, and it's making me say, okay, I have to work on these things now. I guess my question is, if these are longer term issues and conditions, does this take longer, or is it just sort of it's done at some point?
So he's asking like, and were you having like trauma memories? Was it trauma or
Just different scenes.
just different? But were the okay? So a couple people here I find very interesting. That wasn't my experience, but a couple people here. One person is, as we go through and do the lantana and the anise, was having lots of memories of like, car accident, injured the neck, just different like things that were traumatic. And one person wasn't necessarily neck related, but you were remembering just old like silly things or things that at the time seemed traumatic, but like I can tell by his demeanor, it's like, no, it's not that big of a deal. But when it was happening, when you're in it, it feels like it's the end of the world, and then you get past it and you're like, ugh, it was just silly, right? And I mean, some of that could be a shift in the nervous system. I mean, there is a thing like a muscle memory, but my guess is that even when you're unwinding the neck like this, you are affecting like some of the cognitive processes, and being able to shift into rest and repair. That's when those old things kind of come up and they're released. You're not really even like, oh, I need to work on this. It's literally like saying goodbye as it's walking out the door. Like it's just one of those things where if it needs to be resolved, it'll stay in your psyche a little bit and you go, okay, I have to do this, or I have to be at peace with this, or I have to forgive that person, or I have to go, never do that again, never ride a roller coaster again, whatever it is. And so, because even something like fun, like a roller coaster, can cause whiplash. Like, it's one guy had a really severe case of whiplash because he went to a concert where he was going like this a lot. And, it sounds silly, but he was like the next day he could barely move his neck. It can sneak up on you how it happens. And so most likely it's just things processing and leaving. Yeah. That's more of when things release like that, it's more in the intuitive mind when it's, passing out of the psyche. And, like I kind of lean a little bit more with Kadeem here. Like when I have like old memories pass up, come through and pass through my mind from the old days, they're really quite boring and they're really silly. Like they're like, I haven't thought of that since it happened. And it's like, I was at the store and da 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 da, and then this happened, and then they didn't have what I had, and then I walked outside and I lost my shoe, and then just a bunch of really weird stuff, and it's not even traumatic. It's just like a weird thing that happened, and it's in there somewhere. And so the more you let go of it, the more your brain can be in the here and now. Because usually that happens as you get ready to pass. So you're in the here and now. But when you meditate, when you do healing, when you do deep contemplations, when you do certain kinds of ceremony, it just starts happening. It just starts happening. Especially with like Lama yoga or practices of sustained awareness, things will start arising in your mind a lot. Sometimes oneness practices too. Doesn't usually happen with Kundalini practices though.
And then go ahead, Megan, then Teresa.
Hey, Miss Megan.
Hey, this is the best class ever. I have been working on my neck.
I
Not
think I've heard you
occasionally,
say
but
that before.
no, I really haven't. I really haven't. I've been working on my neck like a part-time job for like 8 years. I'm
Right.
not kidding. I wish I could have those hours back because all I needed to do was sit and do nothing until this
Yeah.
class came.
Yeah.
It's like gone. I cannot even
Yeah.
find a spot, a problem, like, and I mean,
Super
even
good.
after just part B of the feet and the kidneys, I was already like, I'm done. I can go home. I don't even need to finish.
Who would have thought the feet and the kidneys would do so much for your neck?
I could not believe it.
Like, who would ever think that?
Like all the stiffness, it was just
Yeah.
gone. And then there's like, oh, a couple little spots, whatever. But just the feeling of like everything is just locked and like just solid, and it just completely went away in like 5 minutes. I'm just
So
amazed.
keep doing it for a little while, because sometimes what happens is you go, oh, like I've done this so many times. I feel so much better. And then I stop doing it, and then I go back and I do a little bit more, and it was like, no, I feel even better than I did before. But I felt so much better that I just was like, I've arrived.
I
I'm
know.
done. Like I don't have to do it anymore.
I felt like I
But
was done
you're
at 10
just better
a.m.
than you were before. Like
Yeah.
keep doing it, because there still could be even greater potential for feeling good.
Yeah, and then also I have two other favorites. I just have to talk to somebody about it, and you're here. Is the fascial release I did with Poplar, those aspects of the will. I just kept thinking
Oh
about
yeah.
like the kids, and you're
Oh,
just trying to get
excellent.
in
The
front of
poplar.
every problem, and you're just, I don't know, just frantic and tense all day. And I don't
Yeah.
know, I just felt like all that tension just like,
Yeah.
yeah, and that's my daughter screaming in the background.
That yeah.
Case in point.
That's the thing that you'll have to tune up from time to time, because it's just life will put the will back into that place again sometimes. And so you just keep tuning that up. But poplar is excellent to use for that, by the way.
Yeah, that
Yeah,
felt
even the fascial
peaceful.
release has a little bit of poplar in it because of that.
Okay, cool. Yes, thank you so much.
Yeah, you're so welcome.
I just love it.
That's part of, like in the old days, they used to use poplar as anointing oil, and that's part of why they would use it, is what it does to refine the will, like regulate and refine the will.
Interesting. Okay, awesome.
Yeah.
I love it. Thank you so much.
You're so welcome.
And then go ahead, Denise.
Hey, Denise.
Hi. Oh, what a great class. I couldn't find the anise. I saw it just the other day, and I looked all over, and just when you guys went to break, I found it. All right. So I just
good.
continued. I went ahead and continued, and
Oh,
used
good.
the anise. I tried the lemongrass and the hyssop, and I think it worked well, but it really made the
Yeah,
anise
the
made a huge difference.
lantana and anise is like kind of the go-to thing. Fennel will work. Araphagy is right there with anise, but the anise and the lantana, you're basically working each head of the sternocleidomastoid. It's just it's a game changer. It's a total game changer.
I have one other question on the breathe ease. Is it easy? Let's see. I bought that recently, and I wanted to know what was in it. Breathe easy. Breathe easy.
Breathe easy. Let me look.
Thank you. And probably I could have held up after I did this class, because I could breathe a lot easier after this class.
Let's see. Just give me a minute. I have several recipe books here. So that has one of the main ingredients is it's got a kind of basil that they call a basil clove, and it's not basil mixed with clove. It smells like clove, but it's actually basil, and it's very, very antispasmodic to the respiratory tract and the gut, the digestive tract of the gut. So it's got that. It's got a fancy rosemary in it, Tuscan blue rosemary, spikenard, Roman chamomile, mandarin, clary sage. It has aniseed myrtle, So it's not anise, but there's a kind of myrtle that smells just like aniseed, and all the myrtles are very good for the respiratory tract. So
Wow.
it's got that. It's got helichrysum in it, and it has kind of a quiet rock star for the respiratory tract is an oil called Ami Visnaga. And Ami Visnaga is very antispasmodic to the bronchioles and the lung tissue, sinus tissue. And so very good for like opening up the chest and things like that. So in some practices or like in herbal medicine, I think they call it pick tooth. Yeah, because I think it's the leaves look like little toothpicks, so they call it pick tooth.
Interesting.
Yeah.
Well, I wanted to know if you thought it would be okay for me to make like a roll-on for my Jared's father. He has pretty bad asthma, and I thought
Oh yeah.
just on his wrist maybe would be okay,
Um,
like with jojoba.
will he inhale it like with
Oh, I
I
think
mean I'd give him the lantana and
you
you know
would.
maybe the breathe easy and have him like
Yes, I will order the lantana, and I will.
yeah.
So how many drops would you say in like one of those small roller balls?
Like the little 5 ml roller balls, I usually put two mils, which is
Wow. Yeah, like a little Melissa.
like yeah, like the yeah, like 60. Do you have a little roller ball?
Nope.
Yes.
Yeah,
And the little Melissa is
a 2 ml. Oh, so if it's the size of the 2 ml, like this is a 5 ml. Well, this is like would be a 2 ml,
Okay.
right? Like that size. And so this would be more of the 5 ml,
Okay.
right? So this I'd stick two mils in, which is about 70 drops.
Wow. Okay.
You don't have to make it as potent as, but like when I make those for you guys, that's what I put in there. And in the 2 mil, I put about 30 drops.
Okay. Thank you. And for him, maybe just do the 70 or, you know,
Do the what?
he has pretty bad asthma, to be honest. And it's a 5 ml.
Yeah, I would do the lantana. Yeah, I would try to rock it with the lantana.
More
I mean,
lantana.
asthma, sometimes you have to unwind it for a little bit, and so there'll probably be a few layers, but lantana is a very good place to start.
Okay. And add a little bit of breathe easy, right?
A little bit of what?
Breathe easy as well.
I would keep them separate, like have
We'll
him
keep it
smell one
separate.
and then the other. Yeah,
Thank you. I
you're
appreciate
still
it. Thank you.
And go ahead. Leave your hand raised if you do have a question. Otherwise, I keep losing you. Deborah and Teresa.
Hey, Deborah. How are you?
Hey, Greg. So I've done myofascial release therapy with John Barnes, where it's physically puts hands on, and people actually go through and experience these things. Like I've seen a woman who in the middle of the air is like her feet are moving like she's running, and then she kind of does like this cartwheel and all this and turns out she was a gymnast and all this. I mean, I could just give you more and more examples of the memory,
And
the
it
muscle.
was on the neck, or it was doing work on the other areas?
Well, different areas of the body, but I
Yeah.
imagine it
So
doesn't really
like you said, muscle memory. Yeah.
yeah, you're
Yeah.
unwinding. So
Yeah.
the fact that people are remembering things that
Right.
coincides with that. So I just thought I'd throw that out there for
Yeah.
people
Thank
who
you.
are asking. Yeah.
And go ahead, Teresa.
Hey, Miss Teresa.
Okay, hi.
Hey.
Just a question. Today was amazing. Thank you. As always, so great and perfect timing.
Thank you.
Given what I've been working through in terms of the energetic environment, I
Mhm.
think I felt the biggest release around the protective webs.
Yeah, not surprising.
And so for me, as I continue to go through this process, and I still feel some, tension behind the, what do I say, under the ears of that kind of almost where the skull hits the SMC. What
Right.
would you recommend for, the next few weeks as maintenance?
You could do the part with the protective web, I think that's the feet and the kidneys.
Mhm,
You could do that quite often. I mean, makes sense with the kind of work that you're doing and the kind of situations that you go through.
mhm,
That makes a lot of sense. And then I'd still do the unwinding with the lantana and the anise or whatever version you did.
mhm,
Um, just because like when you're dealing with a lot of people that have tension directed towards you, even though you might not be aware of it, it still hits you in the gut and it still hits you in the throat. And I would just unwind that so that it minimizes those effects on you. Like a lot of times, like when somebody's upset at me, or they're not even necessarily upset at me, they're upset and they're connecting to me, kind of like
yeah,
of like, oh, I want to talk that out with whatever. And it doesn't feel like negative towards me at all, but I'll feel it in my throat.
yeah.
And it clears up very quickly, but like that's almost when I can tell, like, you know, I'm going to get a call or an email or, whatever it is. It's usually somebody who's like I've been interacting with quite a bit. Like just generally, it's not like any and everybody, like, some student that I've hardly talked to thinks of me and that's what happens. It's usually like, the bookkeeper or the like, like at Astara, the bookkeeper. Like I can always tell when he wants to talk with me because it's stuff like that.
Oh, that's interesting. I work with a lot of finance people. I wonder if it's all the
Yeah.
numbers.
Well, he's grinding on his, he's like the bookkeeping, it's a very throat oriented job. It's a
Uh,
lot of critical thinking and, he's not a stressed out dude at all, but his mind is so like on it that to me it feels like stress, like when he interacts with me. So like I can kind of tell when like, oh, we'll probably talk in the next day or so. And it's because
oh,
of, yeah.
that's interesting. And that's also insightful because I run a lot of big budgets and
Mhm.
I'm stressed about them, but everyone else is. So that would impact the
Yeah.
throat.
Yeah.
Because the mind is overactivated. Oh, and I just wanted to say when I put the spikenard ointment on the sides of the head, I felt thought forms that had been projected at me are gone.
Yeah. I'm not surprised. Yeah.
Um, and then one
Yeah.
last question. And when we are speaking about projections,
Mhm.
a lot of the projections come from the will. Would it be useful to do that protocol as well?
I'm a super big fan of that one, where you
Okay.
do this with the will.
Hmm.
The fascial release, the poplar balsam, the helichrysum, all are super good choices for that. And it's
Okay.
just very, very soothing. And
Okay.
going back to what you were saying, like you feel a lot of energy being projected at you. I worked for this one CEO for a while, and he would make some decision and, I don't know, he had like 8,000 people under him at the time or something. And so not everybody was always happy about it. And he didn't really know like the energetic lingo and everything. But what he would always say to me is, hey, can you do that thing? I'm starting to have bad luck again. And it was just, a couple thousand people projecting like, I don't know about that. Yeah, I hope you, and it would manifest that he would start having bad luck. There would be conflict. Like he had two daughters, like the two daughters
Mhm.
would start having like issues and acting out. He'd have problems with travel. I'd go through cleaning up and it would all normalize.
And which was it all of them, segment 1 and 2 or the willed one?
You know how do the stuff that we talked about like here, but you know how like I don't know if you took the energetic mechanics and the nervous system, how we do the aura.
I know I haven't taken.
Do the aura, but keep going further and further out from the body, because it wasn't actually like his energy body, it was things being projected at him. And
Yeah.
so it actually would actually work away from him, not on him. I'd actually turn around and almost like do like work energetically like out and away from his body, because it's just a bunch of stuff coming in.
Yeah.
So
Was
if
it
I cleaned him up, it would just like he'd feel clean and then come in more. So I would just clean it out the other direction.
okay? So it was penetrating his aura.
Yeah. Kind of, you remember how like when a few classes ago and I had you do that stuff with the aloes?
Yep.
The aloes kind of does that. Like it
Okay.
just cleans things up further and further out from your body.
Okay.
Yeah.
And then I haven't taken the energetic mechanics. I have signed up for, I think it's the mystical energetic protection. Would that be similar or?
They're a little bit different. Like the energetic mechanics is a free class, so you can just get the download and work on it. But it's like we work on the aura and the health rays, but then we look at the neurological aspects that each energy piece is contributing to.
Okay.
And so even if you just look over it, you can kind of use it to problem solve some things.
Oh, that's fantastic.
Yeah,
All right.
and we can send however they need to.
I put the link in there just now.
Yeah,
Oh.
so she posted the link, so you got access to it right now.
All right, wonderful. Thank you very much.
You're so welcome.
And then we have some questions, we have
Yeah.
some shares.
Yeah, fire away.
My neck is looser than before. My sinuses are clear and my headache is gone. Thank
Good.
you.
Very good.
I have abnormal gait, the ability to walk straight. I'm thinking it's the result of my knee surgery recovery, but even almost 2 years out, it might be the SCM trigger point.
I mean, having a knee surgery, that definitely could contribute, but I would still treat the sternocleidomastoid. I mean, honestly, anytime there's a gait issue, I treat the sternocleidomastoid. Anytime.
Do we apply the lantana oil to the neck to address any of the trigger points?
No, it's better in through inhalation. Yeah. The spikenard actually works better topically.
Might my abnormal gait ability to walk straight be treated with valerian / spikenard on the temples and jaws?
That could be a component of it, but you still want to be very specific with the sternocleidomastoid.
With the lantana and anise steps, when we explore the neck, can we focus on tops of shoulders and
Sure.
upper traps, or do we inhale along the sternocleidomastoid?
No, you can explore those other areas.
Lots of release from the back solar plexus with
Yeah.
the fascial release.
Yeah.
At one point, it got quite hot and some heat in the left lower quadrant of the abdomen.
Hmm.
Is there a blend or a single oil ointment that would be helpful to unwind that IT band of the leg? Oh, I guess.
Yeah, you could do terebinth, you could do fascial release, you could do wintergreen, you could do maybe spikenard. I would probably do terebinth, wintergreen, or fascial release. So let's just take a little quick break, and we still have one more little process, or did we just come back from a break, or no, we need to.
Think that after. So we've been just doing questions for 35 minutes.
Oh, then let's do the last process. I couldn't remember if we had done the last process. So last process, very easy, but as you unwind all of this, Still, a piece of this is the throat heavily impacts the circulation of the cerebral spinal fluid, which is how your brain detoxifies and how your nervous system upgrades and how your nervous system adjusts and adapts, regenerates, reboots. And so it's thrown off by the function of the or the dysfunction of the sternocleidomastoid. Here we're just doing a little bit extra to put it in a little bit of a better place, you could say. You know, this isn't going like crazy deep on cerebral spinal fluid circulation. It's like getting that area to eat its vegetables and take its vitamins. You know what I mean? Like it's kind of toning in nature. Okay, so you can use helichrysum, Cape snowbush, spike lavender, healing elixir, three wise men, violet healer. You know, later in the first weekend of December, we're doing the vagus nerve part 2. You know, we need to have a couple classes put in place before we can really benefit from that. And one of the things that we're doing is in that class is we're elevating the function of the cerebral spinal fluid to begin like as it's more filled with light and it becomes more refined, it actually starts to control the sympathetic part of the nervous system, the fight flight mechanism, and significantly regulates the fight flight mechanism. But it's not like you just like, oh, take a pill and do this. You really have to unwind and re-educate other mechanisms before you get to that where it will stick. You know, otherwise you do it and then it just floats away very quickly. We want it to become like this is the way that the nervous system functions. And so we'll you know, we have the body wisdom class and then the class in the middle of November that are all necessary to put in place for the advanced vagus nerve work. And again, remember the vagus nerve is overall wellness in the body, your body's ability to heal, rest and repair, reduce anxiety, release things mentally, emotionally, but also it's how the energy from the heart chakra moves up to the crown. And it's how the heart energizes and illuminates the mind. Like the pathways are through the vagus nerve. And so it's the ones that did the vagus nerve class in August, that was an impactful class, and it just builds on that. So we'll be stepping away from these particular oils and we'll be working with a different oil that's not about regulating cerebral spinal fluid circulation, but like elevating it or like evolving it to something a bit different. Okay, so with that, whatever oil you're using that's listed there, begin inhaling. Your awareness is on the throat. Long, slow, deep breaths with your awareness on the throat. Move your awareness to the jaw minors, the jaws where they hinge in front of the ears. The back throat. Your awareness is on the back throat. Your awareness is on the back heart, the area between the shoulder blades. And the spine. Your awareness is on the spine. And then just be still. Keep your eyes closed, just be still. Again, inhaling, your awareness is on the throat. Your awareness is on your jaws, the jaw minors. Oh, that. Good. The back throat. The back heart. And then the spine. And then just be still. Just be still. Just close your eyes for a moment, let it incubate. Let's do that just one more time. Same oil. Awareness is on the throat. The jaws where they hinge. Back throat, the middle of the back of your neck. Your back heart. And the spine. Your awareness is on the spine. And then just let go. Notice how you feel. Your neck, your body, your mind. Have a nice way to end all that work today, huh? Therapeutically, this is what you would call icing the cake. You know, you do all that hard work, you gotta have a little icing to make that a little extra fancy. So this should help normalize all the shifts that you've just done. Helps to normalize and undo some of the long-term effects of the sternocleidomastoid being dysfunctional. So if you want to do little shares, I mean, I know we just did it, but you want to share or ask questions, unmute yourself or type in. No, feel free.
Yeah, go ahead, Linda.
Hey, Linda.
Hey, so I'm feeling very relaxed, happy, joyful. I don't know, lots of good, wonderful words.
Good.
At the end I sensed kind of a light, if you will, up around my like forehead area and crown area. It was like this glowing, luminous light that I can't say I've ever experienced before, that, in that way. So that was lovely.
Yeah, very nice.
And then a question did arise as we were doing that last part. I'm sure you like spoke to this at the very beginning this morning, but could you say one more time, sort of in a concise way, everything that we've just done today, what is the impact of it on our lymphatic system now?
So the throat is very much associated with lymphatic movement and circulation throughout the whole body. Energetically, the throat chakra is the thing that is in charge of the lymphatic system, but because of the impact of the sternocleidomastoid on the autonomic part of the nervous system, when there's any sort of disturbance in the autonomic nervous system, lymphatic function just shuts down. So like when we were talking about lymphatic function back in module 1, like, the lymphatic technique number 1, very first thing we did is we used lemongrass to balance out the part of the autonomic nervous system to make the rest of the stuff work. And this is like a deeper version of that. Like you're really going at why is the autonomic nervous system getting so out of whack and so often. And the more that you work the sternocleidomastoid, the more that regulates so that even when you get sick, it doesn't distort quite as much. Like it really regulates even in times of distress. And it also is tied to the breathing mechanism. Like your sternocleidomastoid helps to elevate the rib cage, and the movement of the rib cage is also how lymph circulates through the body. Ways. And so there's several different reasons why treating the neck impacts that. And then also because of what we experienced in the fascial component, that when the neck is tight, it's really hard to unwind fascia in other parts of the body. If you unwind the neck first, the other fascia just starts to unwind quite easily. So
perfect.
Yeah.
Great. Well, thank you
It
so
just
much.
makes you feel better. It gives you a sense of well-being. It is relaxing. It kind of chills you out to go to bed. It's all that stuff.
Yeah.
Those are all just like little extra benefits.
Oh, well, I'm really excited about it, hopefully helping me with the sleep process, because what you talked about earlier is exactly what I run into. Is I have so much anxiety about going to sleep because I know it's going to be hard and I'm not going to be able to relax and yada, yada, yada. It's like a whole thing every night. And so I'm really excited to help that. So thank you.
Yeah. And usually the stronger the pain with that, the stronger that drive is when you're going to bed.
Mm-hmm. Yeah. Well, interesting with the things we've been doing since the vagus nerve class, I've had much less pain in my whole body at night. And sleeping has been so much better in terms of pain, but I still wake up every hour and a half or 2 hours, and I got all this agitation all of a sudden in my lower body, and I can't just I feel like I can't leave my body. It's like there's this thing that says, don't leave, don't leave, don't leave.
Right.
Yeah.
Do you think if you're in fight flight when you're asleep, it's hard to let go because your nervous system is like, oh, careful. If you do that, who knows what's going to happen? It's not literally the thought in your head, but but your body is trying to protect it. You know, the part that might even bring you some deeper relief with that is that part with the fascia, where we do the neck and then we do the basic and the solar plexus and go down. Try doing that a lot at night before you go to bed.
Okay, perfect. I
Yeah,
will. Thank you.
yeah, I think that actually might be helpful for you.
Terrific. Thank you so
Yeah.
much.
Yeah, you're so welcome.
And go ahead, Tracy, then Lucinda.
Hey, Miss Tracy.
Hello. So that did balance out like all my stuff. Like I'm just sitting here so chill. I do have a
Yeah.
question.
Yeah.
Does any of this
I love
affect
it when it works out though. Like you're like,
Me
it'll probably work, but you never
Me
know.
too.
Yeah.
So, does any of this have an effect on the scalenes?
Somewhat. So the scalenes for other people, they're like a much deeper neck muscle. Yeah, treating the bronchioles always has an impact, but mm, I would say this doesn't impact them any more than just doing some of the work we've done with the hyssop, you know, with doing some of that and the positional release stuff. You know, the issue with the scalenes is you really have to unwind the torso, you know, because part of it is tied to that paradoxical breathing. And so like you have to kind of unwind the torso a bit for that to work. You know, like here we're doing a 1-day thing on the sternocleidomastoid. We could do a 1-day thing on almost each and every muscle. And we still might do that. I'm not sure. Like it might not be every muscle, but all the big ones, like do a greatest hits. Like I'm kicking it around. I'm not sure that everybody will find it interesting, but scalenes would be one of them. Just like how we unwound everything for the sternocleidomastoid today, there's like a whole nother wave of things to do for the scalenes.
Yeah, that would be very helpful for me.
Yeah.
And I think people who have the problem with it or have neck problems would probably find it very
Yeah.
helpful. And then also body workers, would find it very
Yeah.
helpful.
Yeah.
Thank you. Thank you. I did like one of the things that I was having was like numbness. So I know that's like
Yeah.
a nerve thing. It was just so weird, like all the different things. I'm like, oh, there's
Yeah.
something new. Oh yeah, I hadn't had that one
Yeah.
in a while. But yeah, very fascinating. Thank you so much. I feel so much better.
Yeah, kind of an interesting class, huh?
Yeah, very good. I'm so glad I was
Not
able to.
not necessarily how you would think it would be, but like the thing that cracks me up, like it's out of my notes, but the part about the feet and the kidneys, like I'm like, "Ugh, am I making this up in my head? And I was like, no, this is from my note. Like I've done it like 1,000 times on people, but still, like it's so weird to me sometimes. I'm like, I don't know about that. Like I did on myself, and I was like, man, it totally worked. So, you know, that part is actually in my notes is 30 years old.
I think I'm going to have to go back and listen to what you said because I think I probably wasn't listening as well as I should have been. The correlation between, with the feet and the
Well,
kidneys
the
and
feet is a way to relax the whole body, and
okay.
then the kidneys relaxes the protective webs, and the protective webs directly impacts fight, flight, and rest and repair.
Okay, that makes sense. No
Yeah.
wonder I was jacked up. I was in a convention
Yeah.
center with 50,000 people.
Well, you just, you have customers and you have whatever, and people who don't like you, and then your relatives, and then, it's just, if you really start breaking it down, like I started to do this one time, and I was like, I'm going to have really low self-esteem if I make this list because it's just like, uh, you know, better to focus on the people who like you than don't like you.
Human design has helped me with that.
Yeah.
'Cause I
You know,
can
because
put it in
the
perspective.
issue is, like, as life goes on and you get more experience and you get a little more successful. When I was young, I thought, oh, when you get more successful, you know, everybody will support you and like you and accept you. That is not the case. Like, my experience is actually quite the opposite. And so if you look at what happens in the corporate setting, usually when somebody starts doing better and better in the workplace, people grind on them a little bit more, they backstab them a little more, like, you know, all these things are happening because, like, you're climbing up the food chain, so to speak. And so if you want to be successful in business and, you know, in just whatever, where it's going to be reflected on people, you got to get good at handling people being negative towards you. You just got to get good at it. Otherwise, it becomes a stumbling block.
I get in, I get out. I get in and I get out.
Yeah, and if you think about, like, just look at, like, your situation with your guys' business. You need to make a decision, and do you do the right thing for the business that's still polite and gentle, or do you do the thing that makes people like you more? You know, like, so, like, when you have to look at it from that point of view, it's like, well, of course I do it from the what makes the business better. But then when you're in it and it's like, well, this might upset some people, or it's a tough decision, or, you know, people will disagree with it. You know, can you still do it and be okay with it? And when people are upset, not be reactive and just go, well, you know, because not everybody can see it in the moment. Not everybody can visualize what's happening or see the potential. So they might not agree with it now, but in 2 weeks they like it. You have to be able to be in a place to where you don't rile them up in that 2 weeks so that they can realize it and be on the same page. If that makes sense.
That is very good advice, Greg. Thank you.
It's, you know, you could say it's politics, but I you know, I say that when I'm talking in like because I'm getting back into some of the corporate stuff. And it's not really politics. It's seeing things in depth. Like, you see a greater level of depth perception. And it's what sometimes people call politics, but that's when you're doing it through a battle of will. Like, sometimes you just see, like, this is where it's going, and I just got to keep everybody steady until we get there. But it, you know, we all want everybody to, like, hear the speech and then go, yeah, let's totally, we're all on board, we're going to do it. It never happens. Never happens. Never. I've never seen it happen once. And people, like, go, oh, that might be interesting. But then, wait, what? Like, it never happens. You know, it's just the way we're wired. Like, one person might have the vision, but the rest of us don't. You know, but through experience, which is actually going through the steps and getting to that end result, is still a type of intuition. Like, you know, because you're following steps that is beyond your rational mind. I don't understand why this is happening, but you're producing a result by following. That's, like, considered like low form of intuition. Like, you're basically mimicking something, or you're following what everybody else is doing. There's nothing wrong with that. Like, you know, as long as it's something positive. And eventually you'll have a realization, like, oh, this is what we're doing. Oh, I get what we're talking about. We all do it. We all do it. Like, there's no escaping it. It's not like, oh, some people do it, some people don't. We all do it. You know, you might be good in a couple areas in your life, but in a couple other areas, you're like, I kind of don't get this. Oh, mine, computers. Like, I don't get it. I'm saying that because Robert's sitting here and Samantha's sitting here. Like, they're the tech people, and they'll tell me, and I'm like, okay, just tell me what to do. Better yet, maybe I don't get involved and you guys do it and then tell me how it went. Like, I don't get it. Like, my brain doesn't understand computers at all. I mean, I get the idea, But when it's time to start pushing buttons and doing programs and all the cookies and I don't want to be involved. I honestly don't own a computer. I have iPads. Like everybody else owns computers. I do not. Yeah. Not my area of expertise, you know.
Thanks, Greg.
Yeah.
And go ahead, Lucinda.
Hey, Lucinda.
Hi. I just kind of wanted to share a few things that I thought were interesting. So, you know how you were talking about watery eyes? I had the opposite problem, and I've noticed now my eyes are not nearly as, dry and grainy feeling.
Hey, I don't think it's in the notes, but I almost included that, but I didn't have enough data to where I had produced the result for that to be a thing. But I suspect that to be the case. Yeah.
Well, there's a little anecdotal.
Like any sort of like dysfunction in the eyes, you could almost always go to the sternocleidomastoid. Doesn't mean it's going to resolve it every time, but it's like it's a good thing to like, let's just see what's going on with the sternocleidomastoid.
Yeah, I was kind of waiting for you to say something about it, and
yeah.
And then the other thing during the break, I was doing the fascial release and the muscle relaxation. At the same time, I was trying to manipulate that. And you know how my SCMs are always like so tight. You know how when you touch them, it just shoots pain all the way up.
Yeah.
So much more relaxed. And
good.
Thank you for that.
Yeah. I find it as effective, if not even more effective, than getting body work on the muscle.
Well, I just thought, just do it at the same time I'm sniffing some helichrysum and lavender. I still cough though if I lift I still get that thing in my throat if I lift all the way up, and I notice how hoarse I am right now. So that's interesting that's aggravated rather than better.
I'd still push through and just try to keep treating it. Like sometimes, it's like, but like going back to what you were saying about the dry eyes. When I treat autoimmune disorders, I actually treat the sternocleidomastoid. I suspect that it's a big culprit in autoimmune disorders.
Really?
I've taught that for years and years and years. Yeah, because the spine itself, anytime the spine has a subluxation where it moves side to side, it throws off lymphatic function. Like it throws off your immune system, it diminishes your immunity, and it compromises lymphatic function. If the vertebrae slides forward, it actually causes an autoimmune issue. And so the spine's always played a big role in immunity. And looking at the hip socket and the sternocleidomastoid, the hip socket, I don't know about autoimmune issues, but definitely compromised immunity, like contagious diseases and things like that. More susceptible to contagious conditions if there's an issue in the hip socket. If the sternocleidomastoid, I just noticed that when people have autoimmune issues, they also have a sternocleidomastoid issue almost every time. Almost every time.
I think about that too as getting older, and my body does not keep the same structure. The musculoskeletal structure that it used to. How it's throwing off those other systems as well. It's something to look forward to, right? All right. Thanks.
You're so welcome.
And go ahead, Sonia.
Hey, Miss Sonia.
Do you hear me? Okay, you said sublux forward is autoimmune and no, sublux side is autoimmune and sublux forward is what?
No, forward is autoimmune.
And side is what?
Side to side subluxations compromises immunity.
Okay.
And then we have some shares as well. This has been an amazing class. Thank you very much. It tied so many things together for me regarding my life occurrences and body issues.
Oh, good.
Wonderful to feel empowered.
Yeah, good. And it's not super long and complicated. Like it's something you could fire through. I mean, we did the long, slow with explanations, but you could probably fire through this in like an hour and a half. The whole thing. Yeah, so. Okay, you guys. Well, we are doing a lecture tomorrow on active clairvoyance and the intuitive mind and processing light with Star. We don't have a class tomorrow. We'll be doing our Sunday session like normal. And then the class is or it's not a class, it's a lecture.
Yeah.
But it'll be a bit interactive. Like I'll talk about it and we'll kind of how we do here. We'll do a little back and forth. But Val, class is tomorrow at noon, the lecture? Yeah, so 12 o'clock Pacific time, which would be 2 Central, 3 Eastern time, if I'm doing my math right. Right, so 1 o'clock Mountain. Hawaiian time is, I'll have to ask Robin because I don't know what Hawaiian time would be. But would be 9. Yeah, so. Yeah.
Lots of thank yous. Enjoyed class immensely. Thank you.
Yeah, thanks for hanging out today, you guys. Like, I always love these classes. If you guys like the thing where we focused on the sternocleidomastoid, there's a bunch of muscles. I could do one for everyone, but the other one to do would be the trapezius, the most easily irritated muscle in the body.
Yes,
But,
please.
yeah, yeah, like the source of a lot of headaches for people. Yeah.